far. Oh, okay.
Yeah, you're gonna see the agenda.
Assuming. Yeah.
Oh, wow.
Yeah.
Nice. Live close, yeah.
No, that's good.
But then I'm
We're ready.
easy to say. Yeah.
Ready?
She has.
Okay, good evening, everyone. I'd like to call the special Board of Education meeting an open session workshop to order on this January 15, 2026 at 5 p.m. Hey, approval of the minutes. We do have some. I move to approve the minutes from the special meeting and open session dated May 22nd, 2025.
Second, Nikki Vandermeulen.
Okay, we got a second, Nikki. All those in favor?
Aye.
Aye.
1, 2, 3, 4, 5. And that passes unanimously. Thank y'all. Okay, moving on to the presentation for our new policy, driver's responsibility. So yeah.
My name is Vanessa Cruz, Assistant Director of Transportation and Logistics, and I'm here with Kat Winger from Risk Management and Scott Chihek as Senior Executive Director of Building Services. And we're here to talk about the driver responsibility policy proposal. Just to give you a little bit of a history, MMSD has not ever had a formal policy regarding our fleet and governing the use of our vehicles. So this will help establish clear expectations for the use of those vehicles, which is a really important next step in strengthening our oversight, consistency, and risk control district. As a group, we worked together. We looked at some information that came from our insurance company, and we also looked at other policies area, UW, we looked at other agencies, different districts to kind of see what they were doing and to put together a policy. And I'll pass it to Pat. Sorry, third slide, yeah.
And once again, my name is Kat Winger and I'm the risk manager for the school district. And so our rationale for policy creation, this really kind of revolves around the whole Liberty Mutual. They are asking us from their contractual database right there. We have obligations with them. We also have a mandated status. So that proposed policy is mandatory for compliance and not discretionary or optional. Basically what they want to see is the documented fleet driver safety training. They want to see verification of safe driving practices and ongoing maintenance and confirmation of vehicle safety standards. They also would like us to lower our overall claims, of which we had 33 from January 1st of 2023 until December 31st of 2025. So those benefits of approval, we're looking to improve the safety of our MMSD employees, students, and the public while reducing that crash frequency and severity. We're looking to strengthen the compliance with insurance and risk management standards. Reduce long-term costs associated with claims, repairs, and insurance premiums, provide clear, consistent expectations for all fleet drivers. Reinforce public confidence in MMSD's commitment to safe and responsible operation. Then obviously we have a fiscal impact. We really want to be able to mitigate those long-term costs associated with vehicle crashes and claims. But until we have policy and regulations in place, it's hard to monitor what exactly is going on.
As you see the highlight, the policy itself, it defines 11 areas of responsibility related to the oversight of the vehicles and appropriate use of those vehicles by our employees. This policy that addresses things with safety, right? Making sure our community is safe, our students are safe, and we're also transporting students in some of our smaller vehicles. Interaction between their community and, like I said, ourselves, and also our own drivers are performing the duties and standards that are meaningful, make sure they're safe. I think it addresses who can drive the fleet, how are they going to drive the fleet, where are they able to, and making sure that they're qualified to drive those vehicles. Not just taking a vehicle going or moving things from the school district. General responsibilities of being a safe driver to our community, the responsibility of being a district employee in a relationship to our community. Making sure that we don't misuse the use of our district vehicle. They must own, having the checks and balances to make sure also that something happens to that vehicle, it is reported, shown, they need maintenance and repair, so we don't have a vehicle that is becoming unsafe without being monitored and being monitored and brought back to it again. Safety to staff and our individual. also to the new policy coming into place to enhance the ability and responsibility to make a safer district.
Okay, thank y'all for the presentation. And so each board member has the red line, well, this one would be the new proposal of the policy. It was sent out to folks and it is in board docs. And so what we're gonna do is for each policy, we're gonna have the presentation and then have questions that folks may have and make any proposal changes that need to happen. So I see Blair's hand first. Go ahead, Blair.
Thank you. Can you talk to me about where else that you know of, that anybody assembled knows about, that we talk about drug and alcohol testing in other policies or for other employees, like where else that shows up? And if the answer is not something that people have ready now, it's something I'd be curious about. And then my second question is whether or not in the development of this policy, unions have looked at this, like anyone representing building services employees.
We've had, or as far as the union, we've had initial conversations with the union representative, part of our bi-weekly meetings that we had. Some of the concerns they've addressed about cameras, we're not adjusting cameras at this time. It's more for making sure the fleet's safe and they're complying to safety. We have not had any big, large discussions beyond those facts. They are in support of a lot of this fleet policy because it's the vehicle safety and also ensuring that those qualified to drive are being part of that. There'll be more, so we could be some more questions coming after that.
And I know Valeria, you had a question about the drug and alcohol. That would actually, at this time, we'd have to follow underneath the suspicion. We do not have something formal written into our transportation where we can actually have people tested if there was a crash. That may be something that we look to in the future, though.
Sorry, I don't understand. When I'm looking at the number 10, vehicular accidents, some situations may warrant post-accident drug and alcohol testing.
So we would go on the suspicion. We have a policy on reasonable suspicion. So that's how we would address that.
Great. Can you give me the policy number for that so I can check that out? One sec.
Well, I know, Kat, that I think the employee handbook has something on reasonable suspicion to reasonable suspicion testing. Employees shall be required to undergo alcohol and or drug testing time. The district has reasonable suspicion. And I'll find which provision that's in just a second.
Thank you.
Yeah.
And then Blair, I know like your question, you were also asking, is there anywhere else in our policies where we have the drug and alcohol? Was that question answered then?
Yeah, I'm gonna look at the suspicion of like substance use policy.
Mm-hmm.
Yeah, that does answer my question. Thank you.
Okay, I just want to make sure that you. Go ahead, Nikki, I see your hand next.
I know this is going to sound like an odd question, but the first thing attorneys learn is there's no such thing as common sense without explanation of what constitutes common sense. Because frankly, if we don't explain it in the specific policy, later we'll say, well, you should have known because of common sense. And legally, it doesn't hold up very well. So do we know exactly what is it the requirements that are needed to drive a vehicle as in common sense, or is it the requirements to work at MMSD? Does that make sense?
So we did meet with Liberty Mutual, who came out and actually trained 5 of us to become proctors in order to train other individuals to drive the vehicles. So it should be known that, you know, we are going to be taking you out. We will be testing you out driving our vehicles. And there becomes an accountability. And we have another program at Samsara that we also track our vehicles with currently. So that will tell us when anybody brakes too hard or if they're speeding a certain amount over.
So what I'm hearing is that we're talking more on compliance, less on thought and common sense. Have we thought about explaining it specifically on what,
Oh,
say, compliance and that?
so as far as becoming a driver at the district, you know, background would be run, they would have to follow the DOT standards and obviously we would meet those standards to see if they were able to drive vehicle first of all, because we've never done that where we actually are checking people's driver's license.
I
Then
would
next
like,
training- The
I
training,
would
af-
like,
oh,
oh,
sorry.
sorry. Go ahead.
The training after that, that's when we go in and we would go through all the procedures and everything else of actually being a proper driver and being able to drive a vehicle before we're given a set of keys and actually sent on their way.
I would like that in the policy, that it requires the background check, because I think our staff need to know that what is required and what isn't required, especially nowadays with the fact that driver's licenses, we've got ICE issues, we've got immigration issues, and some people may choose not to, may say, I don't want to go through a background check, or I don't want to go through this, and they should know in advance before they apply. So I think it needs to be in the policy too, not just in the practice. That's all for me.
So I think that the recommendation would be, and Petra, you could put adding it under number 11. Where
Yes.
there's a driver responsibility acknowledgement form. So it could just be added into that form, the requirements for this.
Absolutely. Thank you.
Thank you.
And just to go back to Blair, your question earlier, so the exact section in the employee handbook that you asked about is section 3.14. And it's under the subsection reasonable suspicion testing, just if you wanted to look up the exact section, so 3.14.
Also looking to Petra 4400. I think it more so has to do with students. But there's like those two that are. I think that's the other point where we have some of that language. In general. Any other questions that folks have, particular or any additions or thoughts that folks may? Or we have the experts here. Go ahead, President Nichols.
Thank you. My only question, it might be assumed in here, but I am wondering about inclement weather or school closures. Is the assumption that on the days that the district may close due to inclement weather, that the fleet wouldn't be out? Or would there be circumstances where a fleet may have been parked somewhere? And I don't know if it needs to be in the policy, but I was just curious about that.
I can, usually inclement weather, we're out.
Yeah, we're
We're in.
plowing.
Oh, you're actually
We're
plowing the weather.
We're salting and doing.
Thank you for that.
A lot of,
Okay.
but some of this also goes into, we have some vehicles that are at our alternative high schools and making sure that they understand there are conditions where you should happen, but also when you're a student as well. So those are some other procedures that may come along with that,
Okay,
but our group, we are in.
okay, so that would be kind of covered in the training
Yes.
and then the procedures that you would take a driver through. And it doesn't necessarily have to be its own provision in the policy.
Right.
Okay. I'm wondering, and then just the second question around the vehicle security. Right now, it talks about the vehicles being properly parked and secured when left unattended. Windows up and doors locked. Sounds pretty common sense. Did you receive any guidance or preferences from the insurance company about if there are particular additional protective type driver behaviors that go with vehicle security? I'm just thinking about, like, we live in a college town, sometimes, you know, there can be a lot of activity in certain areas of the city. Yeah, so I wasn't sure if the insurance said anything else about vehicle security that the drivers should know about.
Sure, so they brought it up, just because we have vehicles that are on other places, such as Shabazz, or we have a Capitol High, so they would like to see them all in one place and locked up.
Okay,
But that's something we're working on with Liberty right now. So, and then I also went back to that drug-free workplace, that's also an 8870.
okay, so the insurance, so do they come back later and does the insurance company do any kind of a updated risk assessment on not only how the policy, that we have a policy, and then how it's being implemented
That'll take place during the review.
during the renewal? Okay, and is it an annual renewal? Okay, thank you. Those are all my questions.
And I'll add to that is they've helped to shape this policy to make sure it's compliant with those changing demands and those changes in the insurance world.
Okay,
So it's kind of a collaborative work, making sure that we have the freedom and autonomy to do what we need to do, but also falls in constraints of the insurance and making sure that we're avoiding risk and teaching us that they've been coached and taught how to be defensive driver, how to proper and storage around pedestrians and moving areas. So that's part of what the insurance training is.
okay. I do have one additional thing. If I missed it under the misuse or abuse of district vehicles or some other section, forgive me, I'm trying to scan it as quickly as I can. What about the driver who either gets parking tickets and or is speeding? I'm assuming there's the personal, like, does that need to be named somewhere though? Or is it?
I believe under other parts of where. But we can definitely add this to this. I think it's worthwhile adding the language that you are responsible for your own speeding.
Okay.
If you're violating his traffic safety events, we're not protecting. that
Okay.
authority. Acting as an independent operating that vehicle.
Okay,
I think we can-
I bet you could check to see if it's in the handbook.
Mhm.
is that in the handbook already?
I'm gonna check right now.
Okay,
But I think it's worth adding, don't you think, Petra, just so it's clarified in the text?
I mean, potentially, I think that's something that, you know, you and your group can discuss and we can
Iterate.
discuss separately.
You could also, because it's in here under number 9. But it's not to that compliant, like it's in the.
So we're looking for a statement that employees are responsible for their own actions in the employee handbook
Around speeding and
around speeding.
parking tickets,
Okay.
like that,
Damage.
and damage.
I think we have something from damage, it doesn't specifically note speeding tickets and like that, but it's damage.
yeah. I mean, the thing is, you know, as a previous district employee, I think I do recall something in the book about your own vehicle. So like if I were to drive up to West High School and then be on Regent and then end up with a parking ticket, I'm just saying. I would never speed. Okay, I would never speed, but I remember even as a district employee, remembering that like, oh man, like this $30 ticket is my ticket.
Mhm.
But if you're in a district sponsored vehicle, I could see how there might be an employee who might be like, hey, like I'm the MMSD logo is on this vehicle. I'm just saying,
Yep.
you know, like, is it mine? Really? So I don't think it hurts to maybe be as explicit as we can about that.
Absolutely.
Other than that, this policy makes sense to me.
Yeah.
And I don't know if Blair's.
Yep, Claire, go ahead.
Thanks. This is vehicles to provide transportation for district employees in the performance of their duties. Does this is this just for transportation? Or does this cover like all the pickup trucks and vans and other types of vehicles as well? Or is it just when people are sort of like driving only themselves and a colleague to a conference or a school or something?
All vehicles, all fleet that's on.
Okay, cool. And then my other question is about number 4, about student transportation prohibited unless permission is granted through the risk management office. Is there a process for that we can point to?
Yes, that's risk management actually handles that. So they approve drivers to be able to transport students, whether in their own personal vehicles or in a district vehicle.
Okay, so number 4 here, like the assumption is that there are lots of cases where permission will be granted.
Correct, as long as paperwork follows through, absolutely. So I run all things for the student transport.
Great, that's helpful. Thank you.
Just
Okay. Any other questions that folks may have or thoughts within this first read? Anything else you all would like to add?
No, I think it's personally for us, it's a great step to start getting accountability to take care of our vehicles. And biggest aspect is to protect our community and our potential students from not having bounds to hold, to make sure we're safe. There's a lot of loose ends that we can tie up.
Yeah, to me, it's a pretty common sense. So, okay. Not seeing any other board members at the time hands. Thank you all for your presentation and the creation of this first read of this policy. What will happen next is that we'll make any adjustments that need to happen. Petra will be in touch with y'all as well for any parts that may need to add. And then we will have a second read at a later date that we'll schedule and have a conversation about that. So thank y'all.
Thank you.
Yeah, just so everyone knows, if you're presenting a policy today, I'll be emailing you afterward. I'll have a Word document, and then any action item on your part will be highlighted in yellow. And just email me back if you have any questions, okay? Yeah, thank you.
Thank you. Okay, moving on to our next item, the parental leave policy. And this will be presented by our own board member, Moser Feltham.
Well, thank you. This is really exciting. Thank you in absentia to board member Muldrow, who sort of kicked off the process here, and I've been shepherding it for the past few months. So I think that in general this conversation has been going around for a little while, and here is the first sort of like finished copy of that proposed policy. It's a new proposed policy. Currently, an MMSD employee who is out on leave after the birth of a child uses accrued sick time for the duration of their leave, or is eligible for sick bank days after they've used up all of their accrued sick time. This policy would change that situation. I suppose someone could elect to use their sick leave instead. I don't know why anyone would. This proposes a change to how that would go in the day-to-day by offering paid leave to cover employees who are out after the birth or adoption of a child, after when a foster care child is placed with a family, or in the case of pregnancy loss as a sort of specified category of bereavement. It is proposed as a recruitment and retention strategy. It's humane and it mitigates the gendered outcomes of what happens when employees have children. What you'll notice, I think, if you're paying attention in the world, is that women tend to have their sick leave wiped out after the child, and then you go back to work and your kid gets sick and you're kind of stuck and your pay gets docked and you're like, well, should I stay home or not? This is a pro-family and pro-child policy, and it represents a partial answer to the ongoing questions about what a comprehensive compensation and benefits package in MMSD can look like as things change around us. And specifically, I'm thinking about as the cost of health insurance continues to rise. And next slide, please. This is a district level necessity. The areas in which it touches our Excellence Together framework are in professional excellence and talent development, as well as culture of connectedness and well-being. There's no mandate from the state or the feds on this, which we all know, and that's why we have to take action locally. And so to highlight the portions of the policy, the basics for you to know are that for each child that is born or adopted, the employee who has worked for MMSD for at least 1 calendar year would be eligible for 60 work days of paid leave for each child. So if you have more than 1 child, you would be eligible for as many times that as children you have. For foster care, for parents who are taking in foster children, that's 10 days of paid work days, or the length of the placement. So you could imagine a situation in which someone is placed with a foster child for 5 days, they would have those 5 days, not the full 10 days. And then if it's 6 weeks or 6 years, it would be just those 10 work days. In cases of pregnancy loss, this policy explicitly states 7 days of paid leave to be taken within 6 months of the loss. That is in line with what our current bereavement policy offers for loss of a child. And then this policy also includes provisions for extended parental leave in the event that the child should be the NICU, is hospitalized in the NICU for more than 5 days. The employee would then be eligible for an additional 60 days of paid work days. A couple of other things I wanted to mention. In all of these situations, the leave must be completed within a year of the birth of the child. So in the event that you have triplets who are all in the NICU, you could potentially, according to the policy, have like more work days in a year, but the policy actually says it caps out at a year regardless. And then I think the other thing I wanted to mention is about job protection and benefits. So like being out on like an FMLA leave, an employee would expect to and would be protected to come back to the job that they left. They would stay on payroll and on health insurance through that time. But they don't get additional sick days. And I think that they also don't earn retirement credit in that year. Those are the highlights. What questions do you have?
Yes, thank you so much, Blair, for taking on this, and thank you, Board Member Muldrow, for starting the conversation and getting.
Can I say just, sorry, one other thing? I'm sorry, I can't see who's in the room, but shout out to Rachel Carabell and Ben Ruvers, as well as Petra, for their work on this.
Yep, absolutely. Thank you, Blair. I do see Nikki's hand. Go ahead, Nikki.
You're on mute, Nikki.
One, I have to say it's about time. Thank you for posting this. This is needed, has been needed and for quite a long time, and I appreciate that. Two, when you say employees, do you mean full-time, part-time, total employees? That's my first question. And my second one is, has MTI had any comments or ability to comment on this? And that was
Thank you. Yeah, thank you for your questions. I'm so glad that we have such a collaborative group, because I didn't think about that. I will bring that up with the team, and I suppose, Maya, if it makes sense to you in terms of like a policy process, offer a revision or offer a clarification for the second read? Is that kind of what we would do?
Yeah, so we can, I know because we had the conversation about what it would look like also too in terms of like dollars.
Mhm.
And I know that Bob had started looking at the cost. If this was to be a policy, if it got voted in. And so I think, yes, Blair, to the process, we can definitely bring back after some conversations around that, around what employees would qualify, if it's full-time, part-time, or all employees. And then also probably come with like some dollar amounts as well.
Yeah.
For us, yep.
Oh, and then to respond to your question about feedback from labor, I have been in conversation with MTI leadership about this, but we haven't had like a formal conversation about it. I guess my answer is the same as Scott's to the driver responsibility one. There has been conversation, it hasn't been formal.
Okay, thank you.
Okay, thank you, Nikki, Board President Nichols.
Yes, I want to just thank everybody for working on this. It reads really, I mean, it flows in a way that's easy to follow. I do have a couple of questions. The part of the policy that talks about the interaction with other leave provisions.
Yep.
So it says the term or length of any approved parental leave shall run concurrent with any leaves provided for under the Wisconsin Family and Medical Leave Act and the Federal Family and Medical Leave Act. The term of any approved parental leave or extended parental leave described below shall not run currently with section 14.1 of the MMSD handbook or any other applicable leave of absence provided for in the handbook. Can somebody break that down for me a little bit more?
Sure, I can take a crack at that. So apparently there is a Department of Labor ruling that says if it's FMLA eligible, it has to you have to take the FMLA at that time. And Ben could, or maybe Petra could explain that Department of Labor ruling a little bit more. And so what it means is like if you take your parental leave, the FMLA would be, the clock for the FMLA would be running at the same time. So you wouldn't take your paid parental leave and then your FMLA
Can't double.
for birth recovery.
Okay.
And then use your, so it wouldn't be, you use the paid parental leave, then your sick time, and then another leave, and then to extend it out. So your FMLA, like, what is the word? Eligible, your FMLA eligible leave after the baby comes would be running at the same time as your parental leave, paid parental leave from MMSD would run. But if you're a person who says, okay, I'm going to take my paid leave of, let's say, a single healthy birth of 60 days, and then I want to go in for the child rearing leave that we have in our handbook, where you can take up to a year unpaid to do your parenting thing, that you could still do that. And the reason for that is the idea here is not that like people are going to be taking necessarily like so much more leave than they might have otherwise. It's that they don't have to worry about running their sick leave down, or what if they don't have enough sick leave. So that's kind of the idea. Does that help?
Yes.
Okay, great.
And I'm assuming you've run, that part has been run by legal and HR, so this is possible.
So this proposed policy I worked on with Rachel and Ben. And Petra too. I'm sorry,
It's
Petra.
mostly Ben. No, that's fine. I mean, it's mostly Ben. He's labor and employment.
Okay. Okay, thank you for that. I do have a question about the foster care leave.
Mm-hmm.
And the question is more, how did you all come up with 10 work days whereas bereavement is 7, whereas parental leave for single childbirths is 60, multiples is 120. Yeah, I'm just more curious about how you came up with the number of days, and in particular foster care.
Sure. So let me see if I can like scrape all of this back up. For the 7 days of pregnancy loss bereavement leave matches the currently available bereavement leave for loss of a child that we currently have. So that's where that number comes from.
Okay,
60 work days, we thought was like, let me just get my calendar out really quick. Not my calendar, my calculator. And see if this is accurate. Yeah, so that's like the 12 weeks of family leave that like people are currently eligible for under the Wisconsin State and the Federal Family Leave Act that takes us person through those.
okay.
Is it possible that like if there's a holiday here or a holiday there, it would take them a couple days beyond? Like that's possible. But it's designed to mirror sort of like the family leave that people are currently already taking. And then the foster care leave, this is a number that Board Member Muldrow worked on, talking with families who are foster families about sort of like what that can tend to look like, especially in examples where a family takes foster placements regularly.
Okay.
Or short-term foster placements. So that comes from Board Member Muldrow's conversations with foster families.
Thank you. I think my wondering about this policy comes more into the procedures. And how HR would actually manage this. So I don't know if that's worth discussing tonight or not, but I think for me, it would be important to think about how HR has the infrastructure and capacity to manage the various types of leaves that folks take and request. And then I've always been curious about the cost. So I was happy to hear that mentioned earlier, and if Bob is still working on that, I think that would be an important piece, especially as we're going into the budget season, to really think about what the cost of an investment like this might be. But from a procedural component, Jennifer, I don't know, do you feel like are you able to speak on how is it HR that manages all of the requests now?
Mhm.
So if you had additional types of leave requests, can you speak to how your department would manage that? Or do we have systems in place to add additional types of leave and really manage the number of days and all of those things?
Sure. We do have an HRIS system that manages leaves right now. We would have to do some additional building and additional tracking, and just the number of leaves that we currently have, and then having this be an add-on, I think would require additional FTE to manage these.
Okay. When you say additional FTEs, I heard plural. Are you?
Yes, you did.
So how many people right now are helping to manage our leads?
We have one leaves specialist who does all of the medical, and then we have one leaves specialist who does half medical and half workers' comp.
Can I ask? Oh, okay. Sorry. I trust you, Jennifer.
And for our current employees who go through pregnancy and birth, because it's not a leave and they're taking they're using their sick time,
Mhm.
is that being managed at all at the HR level, or is that literally at the building level?
No, that's maybe I should ask a clarifying question.
Okay, ask it, because maybe I need to clarify the way I
No,
asked
so
it.
if someone goes on leave, like the benefits, the leaves staff is doing the entry of their time and monitoring how much sick time they're using. When they're coming back, when notifying the supervisor of the duration of their leave, the start and end date. Is that what you're asking? Or are you talking about like the substitute at what happens when somebody's out?
No, I wasn't asking
Okay.
that part. I think I was asking about how in our current system, if somebody's
Mhm.
using all of their accrued sick leave, you do have somebody in HR
Yes,
who's kind of tracking that.
yes.
And so if you have a current employee who has used all of their sick time and they're still not ready to come back,
Mhm.
what are they currently doing? That's when they're putting in for FMLA? I don't know, that's what I heard Dr. McCray say. So let's say I only had a certain amount of sick hours
Mhm.
and I've exhausted them. And somebody from HR is like, hey, you're about to hit 0
Mhm.
days left or 0 hours left, or we're assuming you're coming back on this date. And let's say I get that email and I go, yeah, I'm not ready to come back yet. But I would still want to be an employee.
Oh,
You know what I mean? I'm not quitting. I don't want to quit.
yeah.
I'm just not ready to come back, or there's some other extenuating circumstances with my child and my family situation. I need
Right.
more time.
Yeah.
How would you be advising that employee?
There are provisions in the handbook that allow for that unpaid leave time. I think that, I don't remember what number of the policy that was, but that was so that this policy runs concurrent with FMLA, and FMLA isn't paid leave, that's just job protection.
Yeah,
So
okay,
there's a lot of complexities in this and managing it and knowing when people are eligible for which pieces of it are, why I said FTEs,
okay,
maybe 1.5 FTE to assist in the management of this, because we do have approximately 140 people who are out on parental leave. And that's just the parental leave. That's no other type of leave. And we do have other leaves.
okay.
And I believe the section that you're referring to, Jennifer, I believe that's 14.2 other unpaid leave. Does that
Yes,
sound correct?
it does.
So 14.2.
Okay, great. Thank you. All right, I appreciate that. That answers all of my questions for now. I look forward to some additional pieces coming back around cost. I'm assuming cost would include the cost of the additional FTE in HR to manage
Mhm.
this kind of a leave, as well as the cost of the paid days
Mhm.
off.
Yeah.
And is there anything else that we would expect to be in the cost?
Substitutes
And then the cost of substitutes
to fill in when people.
to fill, okay, so kind of 3 pieces to make this work. Okay. Well, I appreciate all of the work done on this, so
Mhm.
that concludes my questions for now.
Go ahead, Martha.
Yeah, I just had a couple of questions. One of them is pretty simple though. When I'm just looking at this just from the beginning, does parental leave including any parent, all parents involved?
Yes.
I didn't know if that was identified somewhere else in one of the other policy pieces, noting that families are all different sizes. And there, I kind of keep going back to like the part where it says if the extended one starts after 5 days in the NICU,
Which part, Martha?
down to number 6.
Okay. I guess what's your question around the 5 days?
Like that's when it starts, or like exactly what it. I guess I'm trying to understand what extended parental leave means when you have it starts after for more than 5 days. An example, my daughter was in the NICU for 81 days. So
So sure, I'd be happy to explain what I'm imagining here.
Okay.
So a parent whose baby comes and is using the parental leave provided for in section 2 here has 60 work days of paid leave. And then when the baby comes, if that child needs to be hospitalized for more than 5 days, that parent has the option to say, I need extended parental leave. So I want to add 60 more work days to the 60 that are provided for in section 2. So it extends the leave to 120 days. And the way I'm imagining it is that employee, in most cases, will already be on leave for the 60 days for the parental leave in section 2 when it comes to pass that the child needs to be hospitalized, and they can apply for the extended leave. Like you're at the hospital, like, 60 days is not going to be enough. You can apply for the additional 60, or I guess it's not apply for. You'll be eligible for the additional 60. Does that clarify that at all?
I guess I'm not sure when it starts. Because like we never left. So I'm just saying like those situations where you don't actually leave, you go right to the NICU and then you're there. So not that you're like, do you know what I mean? Like when does it start? Like
At the
after
end of the 60 work days.
so it gets added on.
It gets added to the end. Yep. And like I don't know, it depends on the family, right? Like if the child is immediately in the NICU, you'll know right away that I'm going to be wanting this extra leave. And I imagine it could also happen that you bring the baby home and things are fine and then they're not. And you go to the NICU and you say, actually, I'm going to need those extra 60 days.
So but you like let's say it happens right at the very end.
I mean, I'm not a person who's going to understand the intricacies of the NICU there. But I suppose so.
I'm just going with there's a lot of that goes on, during the first, the first times there. So I'm just trying to understand where the 5 days kind of came from and what was kind of like using.
Sure. So initially the first draft had like if the baby needs to be in the NICU, then you're eligible for extended leave. And the question came up like, okay, well, my baby was in the NICU for 4 hours. Am I then eligible for 60 extra days? And so we looked at the research. We looked at the research about like how many weeks premature a child or a baby is, and then like what's the average length of days that a baby at a particular like number of weeks gestation is in the NICU. And then we found out from that research that like the average number of NICU days for a baby like between like 35 and 38 was like 3.5, and then before 35 weeks it jumped up to 5.2. And so we said, okay, so for babies who are at that threshold, 5 days is like 5.2 days is the average. So we thought for most families 5 days would provide the like appropriate cutoff for extending that parental leave 60 extra days. And so that's how we came up with the 5 days.
Okay, that clarifies it. Thank you.
Yeah.
Great, thank you, Martha. Go ahead, Nikki.
Yes, you stated about, this is an HR question. It was stated that one of the considerations on cost E is the cost of substitutes. Are there any other policies where we include the cost of substitutes as part of the cost?
Do we have any current policies?
Correct.
Just for clarify, so Nikki, that answer is no, but I don't think that we were trying to include the cost of subs in the policy. It was just what is the overall cost to implement the policy that was actually be reviewed.
Okay, because I know we were discussing additional FTEs and possible costs and that, and so I just wanted to make
No,
it
it's
clear that-
just to review what is the cost of this policy. That when we're looking at the cost of the policy, that subs is another cost that we will also be looking at, just as a reminder of what is the cost of this policy.
Okay, thank you.
You're welcome.
Okay.
Say-
Oh, Sabian, hello. Go ahead, Sabian.
You're on mute, Sabian. Board Member Castro.
Oh, thank you. All right. Thank you, Board Member Moser Feltham and Muldrow and Board Member Pearson for getting this on the agenda today. I am currently experiencing what it's like trying to raise a very young child without paid child leave for either of us. So definitely understand the necessity. Similar to Board Chair Nichols' question, I would be interested in how this policy is operationalized, and then getting a cost estimate as it is reaching. But I think this should definitely be a priority that we accomplish for the district. I know that surrounding districts don't offer this, and as like an educational institution, I think this is something that is long overdue. So thank you.
Thank you, Sabian. Any other questions, comments, or thoughts? Okay, I just had a quick question. In the pregnancy loss and bereavement leave, where it says notification, employees should communicate the need for bereavement leave to their supervisor as soon as feasible with consideration for privacy and sensitivity. Is that a normal practice when we have like bereavement or such? Because I'm thinking like, if I've just lost a child, maybe I don't want to talk to my supervisor about it. Would that then be something I should probably reach out to HR or directly in terms of that? So it's just a question that I thought was like best practices when it's bereavement or something.
Yes, we do allow employees to reach out directly to our benefits or our payroll team to record those. We treat it as sensitively and confidentially as possible.
Okay. So I would just like suggest then if the practice, maybe adding language to say like to their supervisor or to HR and or something, just to add the layer so folks don't know that they can, if they don't feel comfortable talking to their supervisor, that's still the option. So it's like plain.
Sure. The supervisor does generally need to know if someone's going to be absent for,
Mhm.
to bureau subs or, just for their overall planning. So.
Right,
Can
right. And I get that about the bereavement, but this is specifically pregnancy loss bereavement. And so it's like, I want that to be categorized as a pregnancy loss bereavement. And I might not want to disclose that it's a pregnancy loss bereavement, but there's some type of.
Understood,
bereavement.
yeah.
That's what I was thinking more so, because it's a specific type.
In that,
Go ahead.
in that situation, if the employee felt more comfortable reporting it to somebody on the benefits team, they would still have to let the supervisor know that your employee is gonna be out
Absent,
additional
yes.
7 days.
Mhm.
And so,
But it would just be an absence and we wouldn't give them.
got it, okay.
Okay.
Any other questions?
No, I don't have any other questions. That was just the mini question. Thank you so much, Blair, for
Yes.
really like getting us to this point. And taking the meetings and having the conversations and doing the research with other folks and really getting it to this first draft that we
It's super exciting.
yeah,
Yeah,
it's super exciting. 100% in support of it. So thank you so much. With that, we'll take back again the information. Blair is going to work back with folks about just when we're talking about employees, whether is it full-time, is it part-time, like what employees do we mean for the district? For all employees. And there was a question of just about conversations with MCI and with our labor partners. And maybe, I don't know if there needs to be a formal conversation, but there has been conversations going. And then there was just a question of cost, and we'll be working with Bob to get that. And then the questions just around procedural pieces that may need to happen and infrastructure that may need to be added. And then the adding of some language around for the benefits team, because I don't know the best way to state that in terms of like the pregnancy loss bereavement leave. So adding that piece. Does that pretty much sum up like
And
just
employee,
right now?
and
Go ahead.
also which employees qualify.
Pardon?
Which employees qualify?
Yep, that's what I meant at the beginning of like which employees, full-time,
misunderstood.
part-time, or all employees or something like that. Okay.
Got it.
Okay, thank you again so much for those that worked on it, and yeah, we will bring it back for the second read at a later date. Okay. Moving along to the next policy. Policy 4023, the transfer to another school.
Hi, everyone. My name is Fatima Bendada, and I am the Enrollment Director, and I would be covering the proposed change for this policy. Okay, so I have a presentation on the board there. This shows some historical information about the policy when it was originally adopted, and then some chronological revisions for almost more than a decade. The first one was in 2022 when we allowed the current 9 to 12th grade students to remain at their current high school for the rest of their high school after a move. And that at that time also we separated procedure from the policy. They were combined, and everybody who looked at them thought that that was the whole policy, but it was a procedure and a policy at the same time. So then summer moves, they were in the policy in 2019. Now they are in the procedure, and summer moves just allow a student who moves after the last day of school and after the last day of the ending school year and before the first day of the new school year to remain at the school that they attended, and we can apply for an internal transfer the following year. And 2014, the internal transfer policy went to a drastic change related to the process, the timeline, the preferences. In prior to 2014, families used to apply anytime during the school years. There were no strict timeline. So that created some overcapacity at the schools. And that's some of the historical information. And this is historical contextualization of why when the policy was created and what it did address. It was driven more by leniency and flexibility for families versus, helping families go to the school of preference. So basically, they considered not only the move, but the medical condition, daycare issues, change of teachers, and other consideration which are in the best overall interest of the student. So that was the historical reasons families used to change schools. And then as the policy was redeveloped and enhanced or streamlined, it addressed the overcrowding in the school and provided a structured way for families to request schools based on resource availability and versus simple convenience. And the rationale of the change. So before we talk about the rationale of the change, I would like to share what the change is. So the change that we're proposing for the current internal transfer policy is to align it with the open enrollment, the state open enrollment program or policy by allowing students in transition grades from 5th to 6th and from 8th to 9th grade to move with their school without requiring them to apply for an internal transfer, because we're already doing that for open enrolled students. And also align round one application timeline with Wisconsin open enrollment application timeline, because families get confused a lot. So we want to align both timelines to make sure that we're launching both applications at the same time. And why we're proposing this change is it already represents an enhancement, and it did originate from feedback from our MSD community, included teachers, staff members, students, families, and it is also aligned with the strategic framework goal number 2, and it will address the equity issues that we have by offering services to open enrolled families that we're not offering to our own students. And this is summarized in the benefit statement, how we can address that equity issue by making sure that our internal transfer student needs are met the same way the open enrolled students' needs are met.
Hey, thank you so much
You're welcome.
for that. We will start with Nikki. Go ahead.
Yes, when you're talking on equity, I think, one, I agree with the changes, but I want to ask an equity question. Does this equally apply to individuals who use special needs or have special needs services? There was a period of time in a different school district, which shall remain nameless, in which all disabled were told that they were not eligible for open enrollment. And I want to make sure that is not the case with our transfer policy, or if there are separate rules for students with special needs based on caps.
It would not be subject for the internal transfer policy. We have already met with the student services leader and discussed the change in this policy, and that students with special needs are going to be included and be provided with the same opportunities other students are provided with.
Thank you so much. That was my only question. Dr. Gothard?
Dr. Gothard, go
Muted.
ahead. You're muted though.
Oh, I apologize. Board Member Vanderman, you mentioned open enrollment and Dr. Madada was talking about internal transfer. Can we just make sure that we're talking about the same process? Because, and especially how districts determine available seats for children with disabilities, there is a difference.
Yes, you're right. I should have said internal transfer and I meant internal transfer and I said
Okay.
the wrong one. That was a Freudian slip on my part.
Okay, thank you. Just wanted to make sure.
Yeah.
And we do limit seats for open enrolled students. I think that's the reason why the open enrollment was declined for the students with special needs.
And currently we aren't limiting, but that's not relevant to this policy, so I will ask that at a later time.
Thank you, Nikki. Go ahead, Blair.
Are there any like drawbacks that you can think of to these policy changes? And I'm wondering in particular, I worked at West. It was so crowded, and we did not have room for internal transfers because it was so overcrowded, like just filled with young learners. And I guess a concern that I would have, or a question I have is like, okay, but if you make the internal transfer in second grade and then you're automatically in there, do we have any concerns about overcrowding or any other drawbacks
That's
with these changes?
That's an excellent question. So when we run the lottery, we have preferences. And feeder pattern is gets the highest weight. So when we release the results to the high schools, because the high schools, they use they don't use the current school capacity calculation that we use for elementary and middle. So we release the results and we share them with the principals of the high schools. So for West, the principal will look at the students who are coming with their peers from a school that feeds into West. And he will say, okay, these are a go. They will go to the 9th grade at West. Other students will not, because he does not want to separate the peers. So he will let them get in based on the space he has. Most of the time, most of the students who are in the feeder pattern will get to West. Like anyone who is attending a school that feeds into West and is going to the 9th grade, the principal will approve them. And the only grade where we work with the principals directly is the 8th to 9th grade.
I guess I'm a little bit confused because it says that 8th graders, so students currently enrolled in 8th grade who are internal transfers will be automatically enrolled at the feeder school they're currently attending for the rest of their high school years.
It will if this is approved. This is the change we are requesting for the policy.
Right. So my question is about, do we see with these changes any potential drawbacks?
Do I have to answer the question? No, we do not. Specifically from the middle to high, because we have already gone through the feeder pattern and students, most of the principals wanted the kids to stay together, specifically the principal out West. He will look at this category and have them be approved.
Okay. Well, thank you so much for your work on this, and actually all of your work. Generally, I don't actually think we've ever met, and I've always wanted to. So hi, and thank you so much.
Thank you, Blair. Go ahead, Martha.
Yeah, I'm encouraged to see this actually, because I know some families that have been impacted by this. I think it's great that they're looking at feeder patterns now instead of having parents having to reapply every single year. Correct me if I'm wrong, that's what they are doing right now, is you have to reapply every single year to stay in the same, or presumably you might not stay with your feeder pattern. You might have to change after that. But anyways, I think this takes a lot of stress away from parents having to think that they're going to have to continue to try to keep their student with the same class. And I really like keeping the classmates together. Sometimes that's why the change was made. And I know that students who are in special ed sometimes also are a little bit more connected to certain classmates, and there's some great connections that keep students engaged. And I think keeping everyone together and maintaining those long-term relationships is really important. I think this helps to enhance that. Yeah, I don't know if I have a lot of questions. I'm really glad this is going in this direction, because I've seen what happens when we didn't have this as an expectation.
And families do not apply every year. They apply for an internal transfer at transition grades. And this is what we are proposing to change, make it more convenient, and to also align it with the open enrollment policy.
Thank you.
Will it also be obvious to parents you do have specialized transportation? That's something that the team will be considering. So the expectation is not that if they do an internal transfer, if they had specialized transportation, that would be taken away.
We have already discussed that with the student services leader and it's, yeah, and she approved the change.
Kind of broke up at the end. I couldn't quite hear.
And she approved that, so we ran the policy by her and Petra too, who was at the meeting.
I think that's a significant change too. So I just hope that if discussions come up where it talks about this, that if that concern is there, I just hope that that is something that is not put upon as a barrier, or if that's translated as something that they don't have to worry about that. Because I know that's been a big concern for a lot of parents with that consideration. But that's it. I don't know if Michelle, I saw that I don't know if you were adding to that or not, but I'm done.
Thank you so much, Martha. Go ahead, Michelle.
Okay, generally, I would say I'm really happy to see this as well, but I do want to go back to Board Member Mosner Feltham's question. So let's say I'm a parent that resides on the east side. I decided when my child finished their elementary school experience and they were going into middle school, I really wanted my child to go to Hamilton. I applied for the internal transfer and I am okay driving my child across Madison to go to Hamilton. Now my child has been going to Hamilton for 6th, 7th, and 8th grade. This policy would say, because my child is an 8th grader at Hamilton, they will automatically stay with the west feeder pattern.
Correct.
Okay, because there are all kinds of benefits. They're staying with all their middle school peers. They're moving along.
Yes.
Now, as a parent on the east side, I can either accept that the child will stay on the west feeder pattern, or if I want to choose my child to go back to either East or La Follette, I could do that as well.
Yes.
Okay.
If you want them to go to East, they can go to their home attendance.
Whatever my home attendance
Yeah,
school is.
and if you want it outside of your home attendance area, then you will apply for an internal transfer to that other school outside of your attendance area.
Okay, so to Board Member Mosner Feltham, so since we know that Hamilton feeds into West, you're saying that the West High School 9th grade cohort of students wouldn't necessarily be overcrowded per se, because they're already counted as the middle school that feeds into their high school.
Correct, and even if when they are, because now, once this policy is approved, we're gonna be rolling those students to their transfer school, to their
Okay.
feeder school. In the past, we did not, like those who are at Hamilton and do not live in the West attendance area will be rolled over to their home school, like
Oh.
okay, Cherokee, whichever is their school. So the families will apply for a transfer because they wanted the kids to move with their peers to the high school. So what happens, we work directly with the principal and say, hey, the lottery did run and those students were approved or declined. So we will give them their list. West principal has always been in favor of keeping the students together. So we never had an issue with West. With the other high schools, we never had an issue either because there was always space available.
Okay.
So yeah.
Yeah. And it's not based on capacity in the building.
No, it is not.
Okay.
We don't use the same model for the high schools. We don't use the same capacity model.
Okay. Great, thank you. That clarifies it for me. Yeah, no. No further questions.
Okay. Any other questions in regards to this policy? Okay, I did have two questions. So one question is just that, if, for instance, how does this affect people who live currently in the central area of the city that is kind of equal distance to all high schools and
Or optional attendance
Mhm.
area.
because they live in that area?
Okay, the optional attendance area, we have a form.
Mhm.
We have a practice, we use our procedure. We have a form from the beginning, they will select their middle school or they will select their high school. Once they select that school, that is gonna be their home school, their home school attendance area. And when they want to move to a different high school or middle school, they're gonna have to apply for a transfer. Because they have already designated their homeschool at the beginning. So there is a form that the parent complete sign and it's included in the student's records.
Right, and so that this policy then wouldn't necessarily affect them unless they were to put in an internal transfer at some point, and
Correct.
then this would then kick in.
Correct.
Okay, that makes sense. How does this policy kind of fit with some of our, I know we have here where we talk about like dual enrollment, like enrollment in dual language programs and such, like pathways but what about like schools like James C. Wright and other kind of like lottery schools?
Those schools are not transfer schools. They're not subject to transfer. They have their own approval model. They have their own applications. They have their own criteria. So they do not fall under the transfer application.
Okay. Do you think there would be some benefit in kind of stating that somewhere in this policy particularly? I don't know, just a question I thought that might be to like clarify. Cause I know like the lottery in itself has its own kind of procedural pieces, but just so folks don't think like, well, I really want my kid to go to Wright. I want to put in something for an internal transfer, but yeah.
They know because we do have a procedure,
Mhm.
which is very detailed, and we work with we are working with legal departments or with Petra to review the revisions. And in that procedure, we will make sure to stress this request that you made and make sure that families know that if they want that the processes for the lottery school, DLI, and other programs are different, and we can even put links to direct them to the website to apply as needed.
So you don't think it needs to necessarily be added to this per se?
No,
Say like, see other.
yeah,
policies.
the last paragraph does summarize, the
Right.
last paragraph of the policy
Yeah.
does summarize that.
I see that piece.
Mhm.
But it just, oh, I see. Okay, now I see. Enrollment in magnet schools. I missed that one. Okay, got it. Thank you.
You're welcome.
Thank you so much. Any other questions that folks have? Thoughts, comments, changes? Okay, thank you all. Thank you so much for bringing this forward to us.
Thank you.
Okay. And with that, I will say that there weren't any changes necessarily, so thank y'all for that. And we'll bring it back for a second read, if there needs to be any adjustments, so thank you. Okay. So let's move along to
Well,
the next, policy 4610, wellness policy.
Hi, everyone. My name is Ashley Pletzer, she, her pronouns, physical education, health education, and wellness coordinator. So here to talk about the wellness policy. Starting with the history, the original adoption of this policy was 2006, and it's been revised 4 times since. The most recent is September 28th of 2022. Every 3 years, the policy is reviewed to determine if any changes made. And there is the Superintendent's Wellness Advisory that is specifically designated to be a diverse group of stakeholders that would look at that policy each 3 years to determine changes that are needed. Also, there's some requirements, this policy is required by the USDA for any school district that takes part in the federal meal program. And since 2024, that's when they require districts to have a wellness policy. And then they've made some updates with like the final rule, it was called, in 2010 and then 2016. So anytime there's like a new federal requirement, then this would result in updating policy as well. Rationale for the changes, you'll see a lot of red line in the policy. However, lots of the changes are language changes and like clarity of the policy versus change in new procedural things that are new policy requirements. So updated language throughout to be more culturally responsive and aligned to better best practices and or like district language. For example, like instead of just saying cell, we talk about T-cell, transformative cell. And then the second piece is that there were some things that may have been missed in the last policy around like what is required per the federal final rule policy. The example would be is language used to say like when applicable nutrition education should be taught K-12 and it's actually required. So we needed to make sure that our policy was in line with what it said. That's like a small change, but that's not a procedural change because we've always had health education as part of our required curriculum and nutrition education falls into that curriculum. It's just more of making sure the policy is what it needs to be. Also some clarity around smart snacks in school nutritional requirements between like snacks offered / provided / sold or marketed and fundraisers. So just some clarity in language to help with implementation. And then one of the federally required pieces is to have the notice of non-discrimination at the end of the policy, and we didn't have that. So that's just another change. If I broke down each section of the policy. First, the preamble is really just connecting with the vision and updating language. The District Wellness Council, again, just some programming language of like, we've changed the name of it over the years. So it used to be like the District Wellness Advisory Council. Then now it's the Superintendent's Wellness Advisory. Change the language back to just what the federal law states is required, is just calling it the District Wellness Council. We're not changing our name procedurally wise. It's just that the policy is just updated with that. In the implementation, monitoring and accountability section, just some grammar, ease of reading, added recommending school wellness committees. That is recommended, so it's not a requirement, but that language is added in there. And that came from the Superintendent's Wellness Advisory recommending that. In the nutrition section, clarification of free reduced lunch resources, federal law references, stronger language around nutrition education, I mentioned, to align with the federal law. Health education, we took some hyperlinks out, which also had some broken CDC links in there. So that's just cleaning up that. Physical education and physical activity, again, clarifying language, updating language to align with MMFD. We recently updated procedures around specially designed physical education, calling, instead of saying specialized physical education, SPE, we're now referring to it as specially designed PE, so updated that language. Also, other language things like co-curriculars, it used to say extracurricular, we just updated it so that it aligns with the district stuff, and then out of school time. So instead of just, that's like a term, OST or most, that just so that it aligns better with what we're doing. We clarified recess requirements for secondary schools, added in recommends, so language added in saying recommended that activity breaks are screen free to, which that was also a recommendation from the Wellness Advisory. And then just added in some things to promote MSCR outdoor programming that already occurs in our district, being that we're connected together. And then we moved the facilities rental clause of the policy down to the physical environment section. So it's still there, but you'll see it's like crossed out, just better aligned with the model. Health services, some programming and language updates, school culture and climate. I just mentioned like the district language with T-cell, so very like small, minor changes. School counseling, psych and social work. We removed the DPI link. Cause like removing links that aren't necessary, there are some that are required to be linked and that would be there. Physical environment, the building services had just updated some of their language in their section. And then we added that facility use down there. Staff well-being, we've had some work around with HR around staff well-being and kind of revamping or restarting, or not restarting, that's not the right word. Just making changes to programming language around where we want to go with staff well-being, and then also just named some data sources to be a little bit more explicit of where we're getting feedback from. Youth voice, language updates, family engagement, language updates, community involvement and partnerships, language updates, and then some programming updates as well. I think Sonia had just shared with like community partners, just some language changes around things that have happened. And then the non-discrimination statement was added. That is the updates.
Thank you so much. I know it looks very intimidating a little when you so thank you so much for going through each individual section and the thought behind what needed to change. Okay, I see Nikki's hand. Go ahead.
Yes, I have a bunch of questions. One, excellent job. Two, on the federal requirements of the CDC, being that the CDC currently's view on vaccinations may vary widely from the American Medical Association and other healthcare facilities, how exactly are we going to handle that in health education? Are we going to be allowed to discuss vaccines? Are we not to? How do we include that? And should we put something in there, the wellness policy, stating that this is one view? I'm not sure. I truly don't know. But I especially with regards to vaccinations and alternative autism therapies, I am seriously worried that we will be giving parents links to therapies that could be dangerous enough to kill someone. And that really terrifies me. That's the first one.
So first, I would say, do you mind me if
Yeah,
I answer
please.
that? That our curriculum is guided by state law requirements and district decisions and curriculum. So as far as like, yes, the CDC is referred to, but yes, it's one source of information and it's not like the curriculum piece to it. So it is something that internally we can make decisions around, like if there are references right now to something with vaccines, like to make sure that it is in alignment with best practices medically. And I'm thinking of like the health team and Leah's team of how we'd partner with to make that determination. But curriculum itself isn't created from the CDC, if that makes sense.
And I would add one thing to that. I would add one thing to that too, which
Yeah.
is that the references to the CDC, it's really specific. It's to the whole school, whole community, whole child framework. So that is the reference.
Okay.
That's the scope of invoking the CDC. It's not any of their other guidance is not being invoked here.
Thank you, because I was getting horror thoughts of having chelation therapy being linked and other autism cures or alleged autism cures, which clearly don't need to happen. Sorry. Aside, my second thing, this does not change the requirement for the water filtration systems in the wellness policy. I know that we added that specifically in 2022. I was really proud of that. We did that on the floor. Maya, you did a great job. You and I helped do that on the floor, and I'm hoping they kept that.
Yes, that part has not been edited.
That's good to hear. As for policy and oh yes, the screen, and my last one is the screen-free break time. Is there going to be an exception for individuals with disabilities, especially like with me? I had panic disorder when I was a kid. I would go and call my mom, and I want the ability, if kids need to use the phone to contact a parent to calm them down, or to use a calming app to calm them down, they don't lose that just because it's recess. It might actually reframe in those situations.
Yeah, I think that's why we didn't, it's not required to be screen-free, it says recommended.
Okay.
But that is something that I could go back with the student services to discuss, but I think the recommend.
Yeah, I think how we have it in there isn't anything that jeopardize the point that you're raising, Nikki, which I think is an important point. This is in the context of active classrooms specifically.
Okay.
It would not be eclipsing, upending anything that you just referenced.
Perfect. Then I'm good. And you did a great job. Thank you so much.
And just to go back, Nikki, there was like, you'll see like one little bitty change in the water, but it really was, instead of in accordance with, it's per. So it's more of just
Okay.
like.
Semantics.
Yeah, semantics. I just didn't want to say that there was no changes in.
All right. I appreciate it. Thank you.
Thanks.
Thank you so much, Nikki. Next we have Martha, go ahead.
Thanks. This was a long read, being 10 pages, lot to go through. I was trying to find it since I made notes this afternoon. I was trying to figure out like where I was in here. One of them, I was wondering why are recess times being shortened in middle school?
So I wouldn't say shorten per se. I think before it was that, so there's a minimum for elementary currently. So right now it says 30 minutes. If there is a school that wishes to have more minutes, there's nothing that says they can't. And by saying 20 to 30 minutes, it seems like it's a range that it's set versus the minimum is 20.
Oh.
And then, you know, if they want to increase, they can. It's just, it was trying to be consistent with how we lay out the elementary times as well.
So it was 20 to 30 before, and now
Yeah.
at least 20 is the new language. Okay. Is it, can I just, like, I don't even, are they all doing the same thing right now? Do you know, or is that just per school?
I think when schedules are created with schools, there's guidance that comes from the wellness policy and other things that determine school schedules. So I believe all schools are, yes. As this is a part of their scheduling requirements.
Okay. Like going down to that 20, it just made me concerned. I know some kids take longer to get outside and all of a sudden you have no time left to do anything. So we had that challenge. I mean, we started having that challenge in elementary school especially in the wintertime. So that's the reason I'm bringing it up. I'm trying to figure out where I was in this whole document. I was making notes. I should have done a better job of that. I'm gonna come back to, once I find my spot, I'm gonna put my hand up again because I need to finish organizing myself. But that was just like the one thing so far that I had questions about. So I'm gonna let Board Member next one take over for a hot minute.
Okay. Yeah, just raise your hand back up, Martha, when you're prepared to ask your next questions. Go ahead, Blair.
Thanks. Thank you for your work on this. I also have questions about the lowered number of recess minutes for middle school. Can you talk to me about the rationale behind that?
I think it's just the language. So before there was a range, 20 to 30, and to not say that there's like a required amount. So what it now says is students have access to at least 20 minutes. They can go higher if they want.
I see. I understand. I was just a little confused. I got it. That makes sure. That's cool. Tony Evers style veto. I didn't totally get it. When you get to the co-curricular activities and out of school time, is there a reason that MSCR programming is struck from there? Oh, I understand. Okay. I'm just finding the redlining hard. Please don't, it's not struck, it's just moved. I just didn't understand. Okay. And then I had one other question about in Section 8, School Culture and Climate, the Universal Framework for Culture and Climate. is that something that I should know about and recognize when I see that phrase there? Or do I know about it and I'm not thinking of it based on a name? I would have a hard time, I think, pointing to that. And I'm embarrassed if it's something that everybody else knows about and I'm the only one who doesn't, but please explain it to me.
Blair, we talked about this a couple, or Board Member Felton. We talked about this a couple of times in the last two instructional work groups. So
Okay.
we showed you the universal components.
Yep.
Cynthia and Lily were with me, so thinking about and it's actually, if you go back to May and think about the green box on the bottom
That's
of
the rainbow and the green.
yep. So
Okay.
that really illustrates our overall universal framework and the priorities that we have at each level of support and intervention.
Okay, I do know what it is. I just wasn't making that connection. Thank you.
It's new language as well, so no worries at all.
Okay, great. Thanks. Those are my questions.
Okay. Go ahead, Michelle, and then we'll have Nikki and then Martha.
The changes look really good. I mean, they all make sense. The last time we were going through the wellness policy in 2022, we were, board members were receiving a lot of emails from Healthy Kids Collaborative. We had some guest speakers, from our medical community. I'm wondering during during the period of time from the last update, have there been new items and issues that have come up from strong community partners, district staff, or even students that are reflected in updates in this version of the policy? And if so, if you could just highlight what those are, and if not, or if there are issues that have come up, but we're not able to incorporate in the policy, if you could just highlight those. So I think I'm just curious about, we've had a lot of input in the past, from community members when we're going to that final vote, and just wondering if we should be anticipating something, if something has been referenced in the policy that we should know, or if there was something we couldn't address.
Yeah, I offhand, and I can get back to you if there's other issues that if I look back in my notes, that offhand, I haven't heard anything that has come. I mean, talk about the screen-free breaks. That was something that has been voiced.
Okay.
A lot of other, I would say, like advice from the wellness advisory is more like procedural things, like talking about bathrooms in our schools or staff well-being and things like that, that the policy language may not have changed, but like thinking about procedure or like what actions are being taken to support those topics are different. I would say that's how I describe it. I don't think it was, I haven't, we went through a procedure or a protocol with the advisory looking at this almost a year ago. And then we've kind of briefly talked about it since, as far as to update this language.
Okay, thank you for that. I do have one additional follow-up, which is we have indicated that many of our schools are community schools. And I would assume that components of the wellness policy are operationalized in schools that we're calling community schools. And yet I'm also curious, are there things that we do in our community schools that might require any additional language based on what they do? So I know many of the community schools started operating food pantries. Some of the community schools, if they had room, had a parent room or a community room. Some have washers and dryers. Some are running, evening, weekend kind of activities and programs. I know that's not all directly connected to the wellness policy, but I'm wondering through the years that we've now been expanding community schools, if we're hearing things that should be added in here, or do we think this policy covers it all?
We are not hearing anything separate that folks feel are needed at this point.
Okay.
With where we are with community schools, not to say that as we continue to add various aspects of community schools, we might have to come back and look at them. But right now, the way that it's currently written, it fits what is needed for community schools as well.
Okay.
And for exactly those things that you said, like for our food pantries, for our cooking classes that we do for parents during the weekend, all of those various activities.
Okay, so the wellness policy would still guide the way those schools are operating and ensuring all of these components of the wellness.
And just to add in, the wellness policy takes place during the school day. So if there is things that are happening
Outside of school
Yeah.
hours, okay.
Mm.
Okay. Thank you for that. Looks good.
Okay, thank you. And so next we'll have Nikki, then Martha, and then Kelly. We'll have Ollie after.
Hi. On the recess issue, I think it would be easier just to say that it can't be less than 20 minutes. Otherwise, we're going, no offense, but we're going to have every parent under the sun saying we're shortening recess to from 30 minutes to 20 minutes. If we are confused by it, I have a feeling that the parents are going to be equally confused by it. I think that's just easier to do. That's just a personal
Nikki, are
suggestion.
are you asking for the 20 minutes at middle school or 20 minutes at middle school and elementary school, or all schools at 20 minutes?
All schools at middle and elementary can't be less than 20.
Well, so the elementary currently requires 30, so.
Okay,
middle
elementary
school-
can't be less
yeah.
than 30 and middle can't be less than 20, because otherwise people are going to get confused, I think, between the 20 to 30. And then we're going to have, well, you cut lunch recess from 30 minutes to 20 minutes, and that may not be the case. So that's an individual school decision. I don't want to step in school autonomy on that.
And that's what the policy reflects now.
Okay.
Change that you asked for, that's what the policy as proposed has clarified.
Okay, wanted to make sure on that.
Yep.
Second question on the facility rental. I know there's been a lot of questions on who gets priority in that, and I think we've handled it very well on the explanation. So I just wanted to thank you on the rental of facilities.
Do you mean in terms of like the wellness and?
Yes. Yes. That's in the wellness policy.
Okay.
And the last particular one is on IEPs and extracurricular activities. Is there a way we can put a statement saying that students are welcome? Just with special needs are welcome.
Would you like to propose specific language?
I would, do you mind if I have a day to draft it?
Yeah, if you want to draft it and then maybe email it, I'm trying to think of which email, or maybe at the, yeah. I think, how would you want that?
And where specifically were you thinking about possibly adding it?
In the physical and under the physical education, that because oftentimes individuals with disabilities are in separate gym or not given always the same physical activity. I want them to be stated that they're allowed to have access, or that if there are specific activities during the day, that they're able to do it and that they are welcome. Because oftentimes there's a belief that students aren't able when they may be able to participate.
Can I ask a clarifying question?
Sure.
So Nikki, you mentioned physical education there. There is a clause about specially designed PE in the PE section. But I heard you say about extracurricular or co-curricular. So is what's sufficient in Yeah,
Yeah, I could leave the FIAD, but the other two I need.
okay, all right.
I hope that made sense.
The other two.
Yeah,
Oh, okay.
I mean, I would just need language that,
Yeah.
what would that look like? I mean, currently,
In the FIAD, it says all students.
yeah, and
Yeah.
I'm thinking co-curricular, let me find it over here.
And co-curricular,
all
I'd love to have all students.
Yeah, the co-curricular says the district will promote opportunities for all students to participate in physical activities outside of the school day. Activities may include, so it does say all students, but if,
Yeah, let me work on that.
Okay.
I need to think. Thank you.
Okay, thank you, Nikki. Martha, go ahead.
All right, I wrote down my page numbers, so forget. I wanted to have a discussion about in the first section on page 1, where it starts up as a system committed to anti-racism, equity, and ongoing. I was wondering, because last time when we were talking about the verbiage that the district wants to use is more like positive and moving forward language, does that fit there of what we're not doing, or what are we doing instead? Does that make sense?
I think, when the proposed changes were made, we were still going through the stages of the new strategic framework being developed with newer language and things like that for the district, and so, at the time, we kind of went off where we were. If there is a specific statement or, you know, that we need to adjust to better align to language, I'm definitely open. That would make sense, but
I'm just unsure because I understand why it's there. I just don't know what they're wanting to use as more like forward thinking.
This statement.
and can you say
Because
this?
otherwise, what, sorry?
Can you say again, where is it, the as a system committed to that statement?
Yeah, right there. Because it's like, that's a statement of values. And like, do we add other things there? Like, access, do other things need to be included there? Or why did we parse that out?
And not to speak for you at all, but I know that the wellness committee, this did go through several rounds of adjustments and different stakeholders reviewed it. And so my sense would be that the language that's in there now is reflective of what the wellness committee at least wanted to capture. So maybe it would be helpful if we had like if you have like specific language that you'd like to share now or at a later time, like Nikki's doing, and then the group could look at incorporating that.
I'm just always thinking about the community that I moreover represent, so I think about accessibility to things. But I'm also like I said at one of the last meetings that we were talking about the language of not being what we're not instead of what we are is what I thought that the district was looking for. I don't know. Like I said, it was a kind of point of conversation and just trying to open that piece up and trying to like take in all the things that we've been talking about recently.
Yeah, I think, Martha, no, I understand exactly what you're meaning about just using, kind of like, not necessarily deficit, like,
Right.
language, per se, but yeah, if you want to, maybe we can think a little more deeply about like what that might look like and sound like, if not using that language. And then maybe, if you have some suggestions,
That's totally like a conversation.
Yeah.
Like where
I
does
mean, I
that
can
go?
understand exactly what you mean. So yeah, maybe we can have a conversation and see what we might be able to come up with later.
Yeah. Okay, so that was the first thing I wanted to talk about. And then I went down to page 6. And it's labeled, it's the F that's crossed off where the co-curricular activities are discussed.
section?
And
Oh, so it was just renamed. It used to say before and after school. And now it's saying co-curricular activities and out of school time.
okay. I was wondering if we need to specifically put here students with disabilities or students with IEPs, because all the way at the bottom, like the WIAA, the things that happen with swimming, there wasn't an assumption that a student with a disability was going to be able to participate in a after school activity because there was extra help that was necessary in order to make that happen. And I don't think it was very clear nor assumed that that was going to be something that was approved or they were going to be able to have there. I just think being explicit about it is good and is almost necessary within that.
And I think that aligns with what Nikki was kind of referring to, I believe.
Mhm.
It is, and I would agree with my colleague on that. That would be a good place to put it.
Yeah, so definitely open to seeing language, and then I know there's some language with WIA specifically, I believe, around inclusion, so I can.
I don't know if it's they have the language or if it's their language that actually made us think that it wasn't
Gotcha.
going to be supported. So I don't know which way that goes because I don't remember it directly.
Mhm.
So I guess just to clarify so that we know what our next steps are, it sounds like the group will wait to hear from additional language or potential language revisions from the board. And then we'll be looking out for that language. And once that language is received, it can be incorporated into the policy. Just to be clear on who's owning the next step on that.
I can look at that because like I said, I don't know if it's the WIAA standards or assumptions that people are taking from that did not make the assumption that there was going to be support at the table. So
it was based on WIA language assumptions, not direct, and I'd be glad to work with you on that.
Yeah, so if you and Martha, you and Nikki wanna propose some language, then yeah, we can if you wanna get that to, I believe, Petra. Then we can have that conversation of like what that looks like to add that language here for the second.
Okay. Okay. And then I'm going to continue to go down. There's two other pages I want to bring up. One on page 7. Again, this is just we're identifying again their explicit identities of students. And it's another spot I don't see students with disabilities included there either. So could you tell me the reason why we separated out the ones that are currently there?
It might. I don't know if there would, I don't recall like specific conversations of why. I'm not opposed to looking at. I'm not sure if there's like a more general statement that we could make sure that is more.
Could you please clarify which section, just to make sure that I'm looking at the.
7, number D. Number D, letter D.
So it's,
Under staff well-being?
culture and climate.
Yeah, culture and climate.
Oh, culture and climate.
Oh,
is
is welcome and affirm the diverse identities, and then in parentheses.
Oh, some are listed, but not all.
Yeah.
Well, I'm just wondering, like, are we inconsistent on like what we're included when we're bringing up very specific groups? But they're like culture and climate again.
Okay. Okay. We can review language that specifies different protected classes and see in areas where maybe an identity's been left out, adding it in. So I'll make a note to do that.
Okay. And this one, obviously, I'm bringing up students with disabilities. That particular one, but just not really, just, I'm also wondering like why were the ones picked out that are currently there? Like are there certain places that you guys choose from? Why is it inconsistent? I think is my general,
I don't think it was intentional. I don't want to speak for anyone else, but I don't think that was intentional. Or
no, and I wouldn't think that it was. I'm just wondering, like,
And I
do
have to
we
go
have,
back
do we
to
have
it.
consistency?
I think if we were to look back at the history of the policy, different changes, there may have been a specific part in this section around supporting inclusive LGBTQ plus communities in our schools. And then I wonder if then that expanded and then it just didn't fully get to where it needed to be. So that's my initial memory. I'd have to go back and look at the exact policies.
Okay. And then the last thing that I wanted to bring up is on page 9, under family engagement. And it's not something I'm not even sure if like if it would go in, I'm not sure how it would go in here. So when I think of family engagement, it's something that I've heard from families tell me is that like when there are events at schools or other locations, there's not often a tag at the bottom of like emails or invites that say, if you need accommodations, please let this person know. Like that's not always clear and not always a given that there, again, will be a person available to see that whatever need is met or the accommodations are going to be there for them during an event that is like a school-wide event or something specific, whatever it is. But when it's not there, it's not assumed that that is something that they can ask for. So I don't know where that lives in there, but I feel that that's part of family engagement and something that our families will appreciate and connect with when activities are going on and they're being invited to something.
Yeah,
So I think there is a policy that drives like parental involvement
Yeah, we have.
specifically that. So I'm trying to understand. So are you saying for the wellness policy specifically around family engagement, specifically stating something that goes with I
guess I'm saying if it's not here, is it somewhere else that encourages the people who are doing events and engaging with families to be very specific that if you need accommodations at this particular thing, is that something that we are putting out there? Or are we just assuming that people will ask for something specific if they're attending an event?
Okay.
Yeah, and I think if not in policy, like thinking of or re-looking at the other parental involvement policy that you're referring to, but also just thinking about procedures and guidance that goes to schools, I think that's a good reminder of, you know, whether it's dietary needs at schools or things like that for school events, but just something I can, you know, connect with FICE, the Department of FICE to see like what guidance maybe already exists or needs to be looked at again. But I definitely hear you of like thinking about how to make sure that we're being inviting and thinking of that in the forefront.
Yeah, because I like families, like they're not gonna always assume like I'm gonna ask for this, but if you put it out there, it's like please get a hold of this person if you need something. Is more like an extent, like a welcome, and that's kind of things I was thinking of wellness because they're talking about welcoming and engaging families and stuff like that. So that's why I was speaking to me during this read.
Got it.
And that's it. Thank you.
Is it? Yeah, I guess we can check to see if there is some language or guidance, but if you can think of any like ideas or thoughts of like what you want to add to it. We can probably, like in the same vein, send it and we can see how that can fit in. And then you guys can also review it too. So we're making sure that the district is also looking at possible language, and then as us, as policymakers, are also looking at possible language as well that we want to add.
Maya, because
Yep.
my question is directly related. I'm not trying to cut in front of Michelle. Can I just,
Okay, Michelle?
it's
Okay, go ahead.
only a sentence. I happen to agree with Martha, but I also would like it directly in the policy. I'm one of those people who I need to see it because for so long I didn't see it. And there are many wise people who have told me that the most important thing in disability is that we recommend and we list that we are there, that we exist. Because if we don't list in the document, who will? And I think that's incredibly important. And so therefore I'd ask for it to be included in the policy part as well as the guidance. Thank you. I have nothing further. Thank you, Michelle, for giving me that second.
Thank you, Nikki.
And thank you for raising those points, whether around the inclusive, like with the athletics and PE, but also that link. Disabilities.
Okay, Michelle,
Thank you.
just to know, Ali was here, but she's not here.
Yeah. She was attending the math RFP group tonight.
Yep.
Okay, my last question is, in the places where you've said that like we need to be compliant with some of the federal guidelines. As I'm sure many of us know from watching the news, it seems like there are signals that some of the guidelines coming out from the federal government are likely to change. And what I'm wondering is, what does that mean for a policy like this that only is slated to be updated every 3 years? And how might we handle that? Because by the time we could vote on it, there may be new things, and then you'd be trying to understand the impact of that. And yes, I'm just curious because it seems like we're in a changing environment.
I can answer that. Yeah,
Sure.
excellent question. So the CFR that's cited to is specifically USDA nutrition standards. I think that if that were to change, it's something that we being legal services would know about, and it's something that would impact operations of the district and the food service department as a whole. And so it's something that would be on our radar. This specific requirement from USDA isn't something that I think we're necessarily concerned about changing.
So you're thinking that might show up just more in food and nutrition procedures and not so much as how it sits in as an intersection to the wellness
Exactly.
policy?
Yes.
Okay,
Yes.
okay, because yeah.
And to add to, DPI also has like, or the state also has like requirements. It can be slightly different, or they could require more things than the federal government. So there's also like state policy you have to look at too, to make sure that the policy meets the needs. So I feel like if something were to change at the federal level and may not, or may change at the state level, then we'd be making sure we align with that. And although it is 3 years, it doesn't mean like if there is something major that comes up and, you know, minutes increase or something like that, I feel like there's a different process, right, for small changes to policy. Is that correct?
Oh, the typical correction.
Yeah.
Section.
Maybe.
Right, but
no,
that's
yeah,
not,
no.
it's not inclusive of
Okay.
substantive change.
Got you. Yeah.
So if there was something that was a substantive
Right.
change,
Yeah, that would go through the policy.
we would have to bring it back maybe as a red line for a
Yeah.
particular paragraph or section. Okay, thanks. Yes, thank you. Should I take my hand down? Oh.
I don't know. Nikki, I saw your hand again. You're muted. Oh, you're still muted.
She's saying no.
Oh, okay. Sorry.
Yeah, that was no. I'm sorry. I forgot I had my hand up.
Okay, great, thank you. So just to summarize really quick for the next steps for this, Nikki and Martha will work together to bring us some language around inclusivity, specifically for students with disability, with the WIA parts and like the out of school time. Then also, was it also with the physical education? There was one other area, Nikki, I think you had mentioned.
Community engagement,
The community.
parental engagement,
With
parental.
Martha. Perfect. Martha expounding on making sure that resources were available for families and who might they kind of go to ask for those if they needed them. So I'm excited to see that.
I would just quickly add
Yeah.
to, just so that the committee that's overseeing this policy and like legal that we have to
Mhm.
review, I would ask that those changes be submitted to us by January 20th, Tuesday of next week, just so that we have time to review and then incorporate into the policy. Especially as it pertains to non-discrimination, we want to make sure in legal that whatever we're including or altering in the policy is something that isn't gonna change operations. You know, we want to make sure that it's something that we can do. So that would be my ask.
Martha and Nikki, go ahead, Martha. I was just gonna ask what you guys thought about that.
The reason I asked is because it's inconsistent. So I don't know if I'm going to be able to know what is consistently used
Mhm.
as far as when we parse out groups like that. And I don't want to make another version of it. Like, do we have one? Like, I kind of want to know that.
Mhm.
I don't think we do, but I think I can write it, and I think I can update it and include it.
Can we find out if we have one and then we'll put
I
one
can do
together
both.
and
I can do both.
or I don't know. Okay.
I can do both. It'll be done.
Yeah, I think we could probably do, well, first, is the 20th like feasible for y'all? I just want to make sure if you are trying to get like a something.
It's a little tight because I have a dentist appointment 19th, but if it has to be done, it has to be done, and I'll find a way to get it done.
I have people I'm going to model off of who already do that kind of language, so I think that that's a doable time frame.
Okay, so I think what we can do is just, if you all are fine with it, just get what you think or the best language that you can think about that might be helpful, and then get it to legal, and then they can kind of frame it in a way to make sure that it's compliant and have that language. I think that's what you're asking for, Petra.
Yeah.
So again, Martha, like, it doesn't have to be exact, like with exact legal language and stuff, but what you can based off of like your knowledge base and Nikki's knowledge base. And then we'll make sure that it's legally sound, and add any language that needs to be added part of it. Does that sound good?
Sounds great.
And then the other parts that needed to, I think those were the main portions for this policy that needed any adjustments. Okay. Oh, and then also just the language around, for that as a system committed to, just kind of looking at that and maybe figuring out a different way to say it that's not to the point of like a deficit, like language, and kind of aligning with how we're kind of moving with the new framework in the future. So I don't know the best way to adjust that, but we can take a look at that too.
And then just to be, is that like the committee doing that? Is that coming from the board members?
I think, Martha, you were gonna think about that?
Yeah.
Or we can kind of think about it together.
Yeah, I was like, there needs to be some collaboration within that, just
Okay.
because of the nature of everything anyways. And it was something and I really just wanted to bring up so that the discussion was there to have. And because of the presentation of the new language that we're trying to come up with. I want to know what we're for
Mhm.
you know, that's kind of what we want to promote and stuff like that.
Mhm.
And that's kind of what all the other words are using beyond the beginning of that anyways. I just don't know how to do it in a way that's appropriate and respectful. And I just want to make sure that we do that.
Mhm. Thank you for that. Michelle, does that bring anything up for you? Go ahead.
Martha, can I ask, just because I'm trying to understand that last piece, is it that you're saying in that one sentence, like as a system committed to anti-racism, equity, and belonging, the district is committed to? Are you saying like find a different word for dismantling or find a different word for eliminating to make it seem more positive? Or
No, just the very first part, we have anti-racist IEP committee. Like that's saying what we're not doing. Well, what are we doing? And I'm wondering, like, what are we, is that the term that we're gonna use whenever we're talking about that everywhere? Or are we telling people what we are doing?
Fair point. I don't know.
And that's why, like I said, I know it needs to be a bigger discussion,
Mhm.
but I'm putting it out there so we can have it because it's very intentional in this piece. And I'm just taking everything in that we have been talking about the last couple of weeks and the intentionality here.
Yeah.
And
Go ahead, Nikki.
my comment, I understand on the disability point. For too long, when we say dismantle or get rid of individuals with disability, we can't. We're here, we're the way they are. And when you use that language, although it's helpful on anti-racism, it may need and very well may need to be there. The problem being is on disability because there are certain things that everyone keeps wanting to fix us. Everyone, the world. Everyone keeps wanting to change us. I think that sometimes in language, people forget that certain things are okay to be the way they are, disability wise. And that means admitting that we will accept you for you. And I think that's what I am trying to get at on that. I'm not sure, Martha, if that's where you're going on that. But that's the way I saw it, if that makes sense.
Thank you, Nikki.
Oh,
Go ahead,
okay.
Michelle.
Yeah, well, I would be interested in talking with you offline as well, Martha, about that, because to me, when I read that statement, I think being an anti-racist equity leader means that you are working to dismantle inequities that you have discovered in your system, and you are looking at data and understanding where there are disparities and disproportionality and actively working to close those gaps and ensure more opportunities. So if maybe when it reads on paper, it doesn't come across that way, but I guess I'd be happy to talk offline.
I can give you like a quick example. So my other thought was to put anti-ableist in there. I mean, do we need to do that in a couple different ways, or
Yeah.
do you feel that's also covered?
I would put anti-ableist.
Okay.
So I think the next steps is just to have the conversations and provide the recommended language so that the committee, Ashley and Patrick, can work on it and then send it back to the wellness committee for them to decide what take that recommendation.
Okay. How's that sound? Yeah, okay.
Thank you.
So we have all those pieces. Any other comments, questions, or thoughts about the wellness policy? Any last words?
I just say a shout out to, this is a very cross-departmental policy, so there's a lot of collaboration, not only internally, but then with different stakeholders, families, students, community members. So just shout out to all that provide time to look at this and give their input on the policy.
I say thank y'all for bringing forth and thank you for the presentation and the conversation and all the work that y'all do. So thank you. Okay. Now we are transitioning to the next policy, which will be, just give me a second. Policy 4510, anti-bullying.
Hello, good evening. I am Lily Hangartner. I'm the coordinator for progressive discipline in the Department of Student and Staff Supports. And I'm here along with Dr. Leah Esser, who leads our department. Starting with the history of the policy, the original anti-bullying policy was adopted by MMSD in 2010 and has been revised twice. Not, I think by law or by policy, but it looks like at a rate of around every 5 years. So first in 2015 and then again in 2020. So if we were to sort of follow that same trend, we're kind of at that same time frame of potentially looking at the policy again. And thinking about the rationale for the changes that have been identified for potential review and adoption and amendment for the policy. Those would include clarity in how our bullying investigations are conducted, that would be a benefit to both students, families, and staff who would all have clarity and transparency around how when bullying investigations or complaints are lodged, what the next steps are that are followed to give all stakeholders within the district a clear framework of how we're operating. As well as, and sort of within that procedural framework, clear transparency on the responses and supports that are available both to students who may be targets of bullying or potential bullying behavior, as well as students who are engaging in bullying behavior, that the responses and supports are clearly outlined within the policy, as well as a re-examination of definitions that are included within how we define bullying within MMSD, and ensuring that, especially in the area of and the kind of lens of social media and technology use, that we're really lifting and addressing the areas of particular concern where bullying behavior not only might be occurring in large part, but also where there might be particular risks to students, and that specifically addresses the area of social media and technology use in bullying. And lastly, also just a recognition of how this policy 4510 may and does intersect with other both federal and state law, as well as other board policies that already exist. And that would include, of course, the behavior education plan, our non-discrimination policy 4620, as well as Title IX of the Education Amendments of 1972. And all of that is understanding that that the proposed changes within the anti-bullying policy are not mandated by law, but represent a strategic enhancement that originates from a wide array of feedback, specifically feedback from families, students, and building level staff who are navigating these situations daily. And that the goal is that by implementing these updates, that we will increase staff understanding of the necessary procedures and safeguards that are required to responding to bullying behavior, while also supporting the well-being of students who are impacted by bullying or potential bullying behavior. And all of that furthers the district's goal of ensuring that all students feel safe and belong in their school communities, which achieves the second strategic framework of the district, where that all children, staff, and families thrive within their individual buildings and the district as a whole. I could move on to slide one, maybe one more. Thank you. And with that in mind, and as you may have seen kind of from reading through the policy, many of the changes that you'll see throughout or proposed changes throughout 4510 do represent kind of changes in how the bullying policy is structured and organized itself. And the goal of those sort of structural changes and moving different categories around is to ensure that the policy reads in a way that is easily understood by families and staff, and also easily accessed. And that there are some specific potential language changes or procedural investigative changes that are proposed specifically, as I mentioned previously, in updating some of those definitions, and lifting and acknowledging some of those types of bullying behavior that we see as particularly concerning or putting students which are particularly at risk. And in that area, I'm kind of highlighting in specific the cyberbullying definition, as well as the creation of a new section that does further support the transparency and clear procedures that I referenced. And that I'm sort of lifting as the appeal of findings section, also kind of mirroring the language that we use in the behavior education plan, as our suspension, our out of school suspension of how families can access, potential appeal rights if they are concerned or dissatisfied with the outcome of a bullying investigation. And then from kind of otherwise generally, you can kind of see the sort of structural kind of organizational pieces. Many, although you'll see it in the red line policy that many areas might be struck through, that's not to say that that language is now removed from the policy, but that it may be reorganized exactly. And so I've kind of listed all of the potential sort of headers that might be implicated. There may be some minor or some language changes within that you'll also see, but just wanted to lift that though there are large sections of redlined, that in large part that represents just a reorganization of the policy to hopefully support better understanding and transparency.
Thank you. Okay, opening up for board members, comments, questions, thoughts. Go ahead, Nikki.
Yes, does this just students or students and staff? Because on some of the red lines, I couldn't tell if it was staff anti-bullying as well as student anti-bullying. I think both are essential.
Yes, so policy 4510 is a student-specific bullying policy. Although, of course, the potential individuals who could be engaging in bullying behavior is not specifically limited to students. That could also refer to adults that may work within our buildings. I don't specifically support, or my department does not specifically support the adult bullying behavior, although of course we recognize its importance. But I would note that I believe that would be encompassed in the adult discrimination harassment policy, and potentially also within the employee handbook, although Petra would probably know better than I would.
Yeah, Nikki, the 4,000 suite is the pupil suite. And so that
Yeah, I thought so, but I saw staff on the red line and wanted to make sure I wasn't misreading it.
Yeah.
My next concern is something I'm seeing a lot in the criminal law field. We've had a rash of juvenile cases due to nude pictures being sent again quite a bit, and I'm getting 17 and 18-year-old felons. I sat through 3 of them today. And I think we need some language on that, at school language on that, because clearly if I'm seeing it in the criminal field, that's probably only the tip of the iceberg on that particular issue.
Yes, I mean, obviously, as I noted, like within the area that we're in, social media use, cell phone use, and just how ubiquitous it is, and how accessible it is, and also understanding that when content gets put on social media or is sent out even to one person, control of that media is lost from the person who originally owned it or even maybe originally took it. So I think we do recognize that. Of course, there is language within the behavior education plan that refers to those types of behaviors. But I think what often is a stronger protection and support for students who are directly impacted by these types of behaviors is also, would specifically fall under Title IX typically, which obviously provides, because it's a federal protection, a more, in some ways, a stronger and more robust, legal protections. Although, of course, a family would, would be empowered to file a bullying complaint under those same circumstances.
Yeah, I was thinking like catfishing and that, because that was the case a couple of the cases I saw this morning.
And I'll double check if I believe and I hope that the sort of revised definition of cyberbullying would encompass that behavior as well. That language of the cyberbullying definition was sort of reworked to kind of recognize kind of just the evolving nature of how, you know, media and social media is used and may be implicated in these situations. So obviously, if there's any, you know, language tweaks or any suggestions, certainly I welcome that. But hopefully, the hope would be that many of those types of behaviors would fall under that cyberbullying definition.
Thank you. I really appreciate it. Otherwise, great work.
Thank you.
Thank you so much, Nikki. Martha?
I wanted to talk about like what happens when bullying is being done by a group of students as opposed to one person doing it to another or one person doing it to a group.
Yes, so the policy in its current form and certainly in any revised form would still encompass behavior that's either, you know, one student to one student or a group of students against one or multiple students. Generally, the way that would be handled is that any students who are alleged to be engaging in behavior that potentially gives, you know, could fall under our definition of bullying would an investigation, they would all be included within the investigation. So all of those students who might be engaging in that sort of prohibited behavior would be subject to a bullying investigation and then a finding. Does that answer your question? Or are you asking for a different sort of response when we're talking about a group of students?
No, I think I'm going for like a mob mentality kind of, you know, situation where a group is kind of following one person and how that is differentiated, yet still we're acknowledging that this person was there, but these people were absolutely supporting, or people were just bystanders and doing absolutely nothing about it. Like there's different pieces of problems that happens when stuff like that occurs in schools.
And so I think the goal would be that is sort of, you know, flushed out within the investigation. When schools are conducting a bullying investigation, the sort of after the initial communications, you know, with the impacted student or students, the next step would typically be to identify what potential witnesses, whether that's student witnesses or, you know, student and staff witnesses might exist. And so if there's a differentiation in significance or, you know, level of or type of behavior within a group of students that might be singling out a potentially targeted student, then, you know, the investigation as it unfolds, you know, the goal would be that is clear from the investigative bullying report what each student's individual actions were within that framework. And then, of course, when you get to the finding stage, you're sort of applying, you know, one of the main current and would be continuing elements of the bullying policy is this imbalance of power. So I would argue that if we would have a group of students who are all engaging in, you know, unsafe or unkind behavior against one student, that would almost per se give rise to an imbalance of power. But of course, each investigation unfolds, you know, individually. There's not a rubric of when something does or does not give rise to bullying outside of the definition.
I think the other piece I was wondering in regards to this is it talks in here about reporting. Like if a student is going to report that they witnessed it and stuff like that. One, and my question is how easy is that to do? And two, how do we acknowledge that student for doing that?
So your first question is how easy is it to report, to make a report?
Yep.
Yeah, and so I mean, our current policy is not, I mean, we do have a bullying reporting form that families, students staff or really any individual who witnesses behavior that I always say kind of like puts their antenna up, like that this feels like this could be bullying, that we do have a bullying reporting form. And we're always clear that that is not a, like, that is never meant to be a barrier to reporting bullying, right? That like, if you don't meet the exact sort of framework of, you know, you don't report it in the exact correct way, that now we don't do a bullying investigation. That is not our current practice. And some of the proposed language changes actually sort of make that piece more explicit. I think that is within, I think it's on page 3 under 2A. You'll see under the initiating investigation, just trying to be explicit that we don't want to ever put barriers up to how a bullying investigation might be, you know, initiated. So it could be initiated essentially through the bullying reporting form. A staff member could witness behavior that then gives rise to a bullying investigation because they report it to their administrator. It could be a student reporting it to a trusted adult within their building. It could even be an anonymous sort of let's talk that the district might receive where we don't even necessarily know who submitted it. So we try to kind of remove any of those barriers, understanding that sort of social like concerns and also potentially concerns of retaliation may sometimes prevent students from reaching out. And so we want to remove all of those barriers to make it as easy as possible for that to occur.
Can you tell me how we do that on a school level though? Like, what do they have done there that people know? How do we encourage, how do our students encourage to stand up for each other?
So a lot of that, and obviously Leah, if you want to, but like a lot of that, I would say is encompassed within the culture and climate work that, you know, each school engages in, as well as, you know, from the district level, you know, just generally how we, you know, and that's not specific just to bullying, but of course that it's part of that, how we treat our peers, how we treat, you know, adults and students in our building. So I would say the culture and climate work is probably on the global level, really where that learning comes from. And then from the policy angle, and how students are aware of, you know, how can they raise that concern? You know, a student doesn't have to come to a staff member and say, I am being bullied and I want to file a report. If a student comes to a trusted staff member and says like, this happened to me, even if they don't use any of those buzzwords, staff are then trained to know that if they're hearing something that feels and sounds like it could be bullying, that they need to bring that to their administrator, and then the administrator takes it from there.
Kind of answers my question, but at the same time, like, do you require signage to be up in like a space to encourage that? Or is this not connected to what we're implementing down at the building?
Is the policy not connected to what's happening at the building level, or?
This is after this is the things that happen after that happens. Do we also have proactive? I guess I'm wondering, do we have proactive things out there? Because
Yes.
this is okay. Then can you tell me what that is?
Yeah.
Just because I'm not.
Much
It
of
wasn't
our-
clear to me what that was.
Yeah, much of our proactive work lives within our overall universal framework, and this idea of what is good for all is essential for some. And so, for example, when we're talking about safety and belonging for our LGBTQIA youth, we're thinking about what sort of signage exists, what sort of staff training are we providing, how are students represented in curriculum, and how are we explicitly teaching social emotional skills and those expectations. We partner with an organization through the Human Rights Campaign called Welcoming Schools, and a key feature of that program is staff training on how to prevent and address bias-based bullying, which is a conversation we're having right now about how to ensure that every school has access to that training so that staff have the language, the script, the immediate response in the moment of an incident, and that students are able to do the same. So there's a lot of proactive teaching pieces, and we also have some targeted strategies that we can use or all schools proactively, but also if our data or our student experience is telling us that we need to supplement or add additional training opportunities or student education opportunities.
And that sounds great. When we revisit this, if
Right.
maybe like if the slides could show examples of the proactive things that are out there as well, that would be great, just so we know what that is and we know what students are seeing and what that's speaking to them.
And what I hear you too, Martha, saying, and correct me if I'm wrong, like how this is then implemented at the school. So like, is there signage, like if I need to do a report, I know I can send a report to my teacher or something like that. Is that also what you're thinking about too, Martha?
Yeah, like how we encouraging people to speak up for each other instead of just watching what's going on. Like, let's say something, even if it's a little bit of something, is great.
Yep.
And I would like to encourage that mindset so that we're not just reliant on our reaction to things. And so we can kind of have our students help each other out earlier.
Right.
Yeah, I think
Okay.
yep, back for sure.
Thank you, Martha. Do you have other comments?
No, I think that was my main focus for today. Thank you.
Yeah, thank you so much for that. So I also had like thoughts about like possible implementation in terms of like at the school and how it might work with this. Blair, I see your hand.
I have a quick question about under reporting and complaint procedures, section 2B, which is on page 3. And I have a question about the part about identifying recommendations for intervention. Is the expectation that the resulting report identifies available interventions? Like we have this at the high school where the bullying occurred, or is it that the report would be a site at which the administrator would identify recommendations for intervention that are not necessarily available within the school?
So generally, I would say that the resulting report after a bullying investigation would be one specific to the student or students involved, both the targeted student and the student potentially engaging in bullying behavior, so that it's not as vague as like, here are all the things that exist, but really targeted and acknowledging the needs, the support and intervention needs of the students that are actually a part of this particular situation. And so I tried to sort of lift that within the findings, the bullying determination piece. And then under, I think it's on page 6, I think this would be 2D, the responses and supports. Just to make
I don't have
clear
a page 6, sorry.
Oh,
But you must be looking at the red line version.
I am, yes, I'm sorry.
Sorry about that.
Yes.
Okay. So my question then was on, go on, sorry, Lily, go
Oh,
ahead.
no, it's okay, go ahead. I want to make sure I'm understanding, or I'm
The
not.
question that I'm asking then is on page 5 of the red line version.
It's under the
Yeah, bullying determinations. So the administrator investigates and makes a determination and writes a report. And in that report, they're identifying recommendations for intervention.
Yes.
Our schools have robust interventions, but they don't have every intervention.
Sure.
Is this a situation like I guess to be totally honest, I'm thinking about myself as having worked in this like part of schools. Like I wish we had this intervention, but we don't because this kid could really use it. Is this a moment where an administrator could say, hey, this is the intervention we need according to this situation, and like we're using this policy to sort of like move towards that intervention? Is that and if that's not the intention, then do we want to say identify available recommendations for intervention?
Yes. So I would say, a lot of our interventions are not only housed like directly within our buildings, but also through the partnerships that, you know, we already engage in. So,
Okay.
and this is just as an example, but like, you know, our behavioral health, you know,
Sure.
partnerships, or, you know, any of those partnerships with our community partners, those would be necessarily included as potentially available and appropriate interventions, depending on the needs of that student or students.
Gotcha.
Yeah, and then obviously, if there are, you know, interventions that we don't necessarily have access to through a partnership or sort of in-house, I think that maybe is where it might get trickier, because how does a student access, you know, like how we would obviously support like that as schools do even outside of a bullying investigation,
Right.
to sort of support students' ability to gain access to those other interventions. But just to say that like our interventions are not necessarily just what is housed within, you know, like by our specific school staff, but also through our community partners.
I would imagine that like something like our partnership counts as an available resource. So I think my comment is to add the word identify recommendations for available intervention.
Got it. Got it.
Thank you.
Available.
And my recommendations
It's a
for
bullying determination.
available.
Appropriate responses and available interventions impacting their student.
Great.
Thought it
Thank
was identify recommendations for available intervention and identify steps and supportive measures.
Yeah, there's a
Yep.
couple. Okay,
Okay,
that's good.
got it. Thank you.
Any other comments or questions, board members? Okay, I did have a couple questions or thoughts. So when we're doing the bullying investigations, 2A, so a parent, my kid is being bullied as a parent of a kid in MSC. My kid is being bullied. I tell like the principal, my kid is being bullied by this group of kids. The investigation then starts. We fill out the form, the report of bullying incident. I would like to build in here something that also says that the parent gets that report. I think
The resulting report.
no, the initial report.
Oh, yes. Okay.
Of the actual bullying. Because I think what ends up happening and what I hear a lot and from personal experience with children bullying my children, I never knew there was a report that was ever completed. Never got one,
Yep.
never got a response, don't know what happened. In multiple cases. But then I'm also hearing like other families having this experience, whether it's like a staff member or other kids bullying their kids, or folks, a community organization that's using the building. There might be some bullying that's happening with their kids. And so it's like, I think having that initial document for that parent to be able, or that child's or family to be able to follow up on, I think is extremely important. And maybe like adding in some parts of like who then they can contact to make sure that the process is still progressing.
Yep.
So like here it's like, okay, the administrator, say we get the initial report to the parent. I'm not really seeing like touch points outside of that last initial, here is the determination.
Yes.
And so I wonder what it looks like to add like touch points to ensure that parents are aware or families are aware on, I see the ones where it's the person who is doing the bullying.
Right.
There's like the investigation, we talk to the families, we inform the families, but I don't see the built-in pieces for the child who has been harmed and the family
Yep.
has been harmed until the determination actually happens.
Yes.
Yeah.
So there's a few places, and obviously, again,
Yeah.
the language could be strengthened or, you know, adjusted. that I tried to sort of acknowledge exactly the situation that you're referring to, knowing that, you know, a complaint or report can come in a variety of ways.
Right.
So you'll see on page 5 under, this would be conducting bullying investigations. I think that's 2B. That kind of at the top of the second paragraph, the sort of a statement of at the outset of an investigation, the targeted students and their families will be notified if they were not the reporting individuals. So sort of acknowledging, like, obviously, if I send an email to the principal saying, I want this, then I know that it's happening. But sort of, this is sort of, the hope is that this kind of acknowledges that situation where a staff member maybe is the reporter or an anonymous person. And then there's also another place under the confidentiality, which starts on page 6, and that's number 3. This was sort of an area where we wanted to be where we were really trying to balance, obviously, the rights and the due process rights of the student accused of bullying, who obviously have a right to be a part of this investigation and for the student and family to know that this is happening, and balancing that with what we saw as a real concern of retaliation or like blowback on the student who's now like the target of this bullying, but now if there's this investigation, might other students or the students who are already kind of singling them out, like, is that going to make it worse for them? Essentially?
Right.
And so I tried to, like I said, really balance those two rights and needs in a way where we are being fair to the accused student, of course, as well as acknowledging the safety concerns, because that is something that I see from schools is like, right now, when the report comes in, the language of the policy almost suggests like you must move forward with an investigation, which makes sense from a staff lens, like that they can't dismiss it, like staff should not be dismissing a report. But then sometimes like also acknowledging that the student or family might, I don't want this because X, Y, and Z is going to happen, because when you're investigating or you're people are going to know who we're talking about, you know? And so that's kind of why I was trying to sort of balance that, because it's difficult, and really respecting maybe ultimately the wishes of the the targeted student, that if they feel strongly that this is only going to make things worse for themselves, that we're really taking that input from their family and the student themselves.
Yeah.
I don't know if that feels responsive enough to what you're saying.
Somewhat. Somewhat. I mean, I still would like to see like in that, I think on page 4, the red line at the top, where it's like once the report is filed or like completed, even if there's something like, you know, following the confidentiality piece, like that the parent still has access to the report in itself.
So maybe at the end of the initiating investigation, just an acknowledgement of that the targeted student's family has a right to access whatever the initial report was.
I mean, I think it can be somewhat implied, but to Nikki's comment, I think with the first policy, just around sometimes there might be they'll think like, okay, I can do it, but that it's not explicit within the policy. And I think making it more explicit here, I think is better. That way, even if families and community are reaching out to us like, hey, this is happening to my kid, like we can say in our policy, like you can request this form. And then folks know, like per our policy, that family member, it's more that they can access it.
Got it.
And I know like there might be some like pieces that might need to be redacted or whatever because of like, you know, confidentiality of like student information, but just to at least have it, I think is important.
Gotcha.
I was going to add, if I may, that both families need to be able to get a hold of it, because in case of one where I believe the students, please do not get me wrong, but in rare cases where something ends up being proven not true, I think both sides need to see that, both groups.
Thank you, Nikki. And just for the public, I know that we just have 3 board members on camera, but we still have quorum. Just Blair's here and Martha is still here. I just want to make sure that that's clear as folks are looking. So I think that was the only thing that I was thinking about. And no, I think answering that question is good. And maybe I'll have some thoughts later. Because I have some thoughts around like how restorative justice might actually be incorporated in this. I know it's like part of like BEP and things like that, but and it might be part of those interventions and resolution pieces, but I would be interested to see how that might fit into like within the policy itself.
Yeah.
So those are like my last questions. Any other comments? Nikki, your hand is still up. Is that just from last time? Okay, it sounds like it's from last time. Any other comments, questions, thoughts? No? Okay. Then we're good. Thank you so much.
Thank you. Appreciate it.
We are rolling along. We have 1, 2, 3 policies. The next policy is 4113, administering medication.
Good evening, everyone. Let me introduce to you one of our lead nurses, Mandy Monson, who will be presenting this evening on our med administration policies. Go ahead, Mandy. Thank you also.
Thanks, Leah. My name is Mandy Monson, and like Leah said, I'm one of our lead nurses, and I am going to present on this policy. So the administering medication policy is in place to protect students' health and safety, and to ensure compliance with Wisconsin law and other DPI requirements, and to clarify roles, responsibilities, and authority all around administering medication. You can go to the next slide. There's some changes in the medication, and similar to the wellness policy that we saw tonight, there's a lot of red line in our policy, and some of that is wording and semantics. But a lot of the rationale for changes was grounded in compliance with state statutes and admin code that you see on the slide. The policy is also part of our MMSD's health and safety governance and was last revised in 2014, November 2014. So just the overview, we clarified definition and scopes by updating key terms. We strengthened authorization, consent, and documentation requirements on the policy. We expanded and formalized the emergency medication provisions, some of that were already in practice that needed to be updated in our policy. And we updated student possession and self-administration rules as well.
Okay. Thank you so much for that update. The medication policy has been in our possession for a long time. But I'm grateful though that we held on to it to continue and allow you guys to have as much time as possible to do it, because there are so many intricate pieces, and I appreciate all the work that the nurses and you have put into making sure this is a good document. So I'm excited to talk about it.
Yeah, we're excited for it.
Yeah. Any questions from board members? I know there's a lot here, but wanted to make sure. Go ahead, Martha.
I'm very glad to see this here, as I feel that this is very impactful. And I do have several questions on it. I'm wondering if there is any accidental administration of medication, what goes home to the parents? Do we cover that in here? Because I didn't see it noted.
Yep, that's in the policy. When we do have a medication error, that would be included in accidental medication given, I think is what you said would be included in a medication error. And
What if
in
it's
that-
accidentally, but what if it's accidentally administered by the student themselves?
Yeah, so what is your question, Martha? Can you
What is,
clarify?
what does the parent get when that happens?
The
Is that
parent,
also,
yeah, I don't know, to be honest, if that's directly addressed in the policy, but the parent should get a phone call.
So,
Yeah,
just to jump
a
in.
notification, yeah.
Yeah, so I think if you look at on the non-red line version of the policy, so just the proposed one, page 4, paragraph 10. In the event of a drug product administration error or a medication incident, the parent/guardian will be notified. A written incident report explaining the error shall be completed by the school nurse or MSCR director's designee or other employee involved, if any. And such report shall be sent to the Director of Health Services or MSCR director. So I think that, well, I know that medication incident, medication error, it's non-specific to whether or not that's related to a staff member or a healthcare provider or a student. And so under the language of the policy, yes, even if the error was by a student, the parent under this new policy would be notified.
can you point out where that was? Because I
Yeah,
did
of
not
course.
see it on page 4.
Yeah, so page 4 on the non-red line version, it's paragraph 10. It starts off in the event of.
Okay. So it doesn't say anywhere in there though that the parent actually gets anything in writing. Calling them and letting them know that it happened is different than getting a written report about what happened and getting to hear from everybody and from whatever gets put on paper. One is immediate and the other one is like looking at the entire situation. Those are two very different things.
I think we could take that conversation back to the team and see what makes sense and is within the bounds of the law and policy.
So Martha, what I think you're saying is that specifically for this, maybe adding like language that says like such report shall be sent to the Director of Health Services and like a parent will be notified or incident,
They're already notified, but what she.
but like in writing is what you're asking.
I think the parent should be able to see the report because it's important to know what happened, who was involved, and I would expect that there would be additional training or something that would happen afterwards. But really, in order to understand everything, you're going to need to know the extent of what happened and all parties that were either there to see it. Just, I don't know who would be involved in a situation. But I will say that right now, the parent doesn't get anything.
One thing I would like to lift up too, I think the written notification is one question that sounds like the healthcare group is gonna discuss. And then the written incident report that is completed by the nurse or MSCR director that's sent to the Director of Health Services, that would be a part of the student's education record. So that's something that a parent could request as well.
I don't think the parent should have to request it. I think the parent
No,
should have access
yeah.
to it right away.
Of course.
I think I definitely think that having a written report for a parent is something that we should take back to our team and talk about. I appreciate that point. And I appreciate it's a difference in calling you and talking to you about the situation, calling a parent and talking about the situation immediately is obviously like the first thing, one of the first thing that happens, and then giving you like a wrap up. almost similar to what we were talking about in the bullying report. The report that is given to the Director of Health Services, I wonder, I actually don't know that that's part of the pupil service record. I believe it's a employee record and it is filed like in our HR. So it might need to be a different report. We might need to talk about a different way to do that because currently it's more of an employee report and it's not necessarily a pupil record. Yeah. So, but I appreciate that. I appreciate that thought.
I also want a time frame put on that then, because the closer to the incident that something happens, the better everyone is going to be able to report on something. I think there should be an expectation that it has some sort of short turnaround within a week or so. I don't know. I don't think it should go beyond that.
Okay. So what I hear you saying is that I think there needs to be some clarification just in this policy, just as what the written incident report is. Because it might be.
There's not anything right now that
Reading this, it
automatically
might
goes to
look
parents.
like it's an incident report specific about just the student that then will go to the student pupil record. Or is it?
Can I make a recommendation?
Yeah, go ahead.
I think what should happen is that the committee with the nurses should figure out what is feasible to meet what board member Saravo is asking of. So what I heard her say was it would be nice if families could be notified and within a time frame. And the reason why I'm saying feasibility, because I also recognize like I wouldn't want to say a day knowing that nurses couldn't give something that quick. So I'd rather figure out like what is feasible to meet that threshold, what she asking is, what can be a written notification, and what should be the recommended timeline.
Yep.
Can I respond to the question after she does that?
Yeah, I just want to make sure that Martha, does that I guess does that necessarily answer your question?
Does it cover my concerns?
Yeah.
The concern is about that there's nothing provided to the parent right now if that incident occurs. A phone call is not enough, and it doesn't actually give a parent an understanding of what happened in that situation. So those are my concerns. I'm also just cognizant of people's memories being able to be accurate the further away that you get from an incident. And then for people to react to something, you need to. It's a lot. So I'm trying to understand why the parent doesn't get anything. And I would like the parents to have notification if something like that happens, but not just being notified over the phone, but have something in writing so they can truly understand what happened and not having to go and request it.
Yep. Okay. Go ahead, TJ.
No, I was gonna say, I just think that the next steps have already been established on what could happen.
Okay. Okay.
And the other thing I wanted to bring up is kind of tied a little bit to that. I'm trying to figure out where I had that in here, but there's an identification of grade 6 and above. Trying to figure out where that language is because I forgot to write it down.
Page 4.
Student possession of medication. Students grades 6 and above may possess self-administered non-prescription medication.
Yes.
Okay.
Why is that appropriate?
I'm sorry, can you repeat that?
Why is it appropriate to say students grades 6 and above can possess and self-administer medication?
So that paragraph really relates to our secondary students, grades 6 and above, possessing and administering non-prescription medication like acetaminophen, ibuprofen, Lactate, Tums. They would have to have the same requirements as any other student, meaning they would have to have a parental consent And in addition, they would have to have our contract around self-administration. So right now, we currently have a contract that a student, parent, and the school nurse sign around self-administration of emergency medications like albuterol or short-acting bronchodilator or an epinephrine. And so this policy change would be including those non-prescription medications for grade 6 and above. And I think anecdotally, we know this is happening in our middle and high schools. Our high school students are taking ibuprofen for cramps, Lactaid for their lunch without any notification, without any of us knowing. And so by putting this policy in place, we're hoping to have more clarity and cohesion around that with parents and students.
So I have a concern for students who are in a grade, but yet might have like a developmental
Yep.
under a way that they're underappreciate the importance of medication and moderating and doing things
Yeah,
like that.
I definitely appreciate that, and that is a conversation we've had, and that's why we do, in order for this to be allowed, that student would have to have the self-carry consent, and it's a contract that the school nurse, the parent, and the student all read and sign. So, for example, in our elementary school, I've had a 2nd grade parent want their child to self-carry their albuterol and give it to themselves. And that really meant that the parent and the student need to come into the nurse and show me, tell me, we need to all agree. Do you know how to do this? Is it appropriate developmentally? Is this appropriate? Is this appropriate for this student? And so, you know, I think that that's where it's not a blanket statement saying that any student in grade 6 and above can just have this medication. It's that they can have it as long as there's a parent guardian medication consent and that there's a self-carry contract on file.
What prompts the grade 6 being up in there though? Like I'm just struggling with why all of a sudden grade 6
Yeah, I
when we
think
have all those other things.
Yeah, I think developmentally, that's when we see our students in our school district kind of start that independence. And when middle school starts, it's a transition. We work really hard with 4th and 5th graders on when you go to middle school in this 6th grade and we're starting independence. And then we see that independence through middle school. It's also seemed really hard to say like, we can do this for 8th grade, but not 6th grade. And that we know that those middle school students are in a range of developmental, there's a spectrum of development and maturity in those grades. And so again, that's why we're offering it to be a discussion with a parent, guardian, nurse, and student with that self-carry consent form for students who it's appropriate for. And, you know, it won't be appropriate for every 6th grader, but there are definitely a chunk of 6th graders who that will be appropriate. And, you know, we definitely have students in younger grades who it might be appropriate to, but we're not opening up for elementary school at this time. But there's 2nd and 3rd graders who know when I drink milk, I need my Lactaid. Like they just come down to the nurse and we give it to them, but they know that. And so we're gonna honor that middle school independence with this part.
So as long as there's an authorization there that they're required to have, so that's the okay. And so the other piece I just wanted to talk about was they're talking about emergency medication.
Okay.
How do we have something that says how students, I was trying to like, you cover a lot of different, like very specific ones in here. If they're kept they are typically kept in the nurse's office. And then if the student also has one in their backpack or assumingly, let's say in their locker somewhere, because they would need it. Is it up to have something in policy to make sure that the school has something set up to make sure that that goes to a certain place during the school day? Or is that up to each school to decide how that gets handled, where that's kept?
Hmm.
Where what is kept, sorry?
So
Emergent-
emergency medication. So the emergency medication discussion in our policy that was added to the policy is around our stock emergency medication. And so that is the things that's the sections that start on page 5. So above that, let me just look. I believe there is, discussion around students with self-carry. Again, that is typically for short-acting bronchodilators and epinephrine delivery devices, but Petra, I'm not, oh, here, it's on page 4.
I want to make sure I'm understanding the question. What are we concerned isn't being captured by the self-carry provisions and the emergency medication that's already specifically discussed?
Where are they kept when the student has their own? And there's also one in the health emergency office. Is it okay for the student to have it with them in their locker, in their backpack? Or do we have a point of contact to where the nurse will house it during the day? And is it consistent across the district to do it that way? Because you do point out a few specific ones. Obviously, there's a lot of different types of emergency medication.
Yeah. So I don't believe that we address your specific question in the policy about where an emergency medication that is not the emergency medication that the health office is storing is kept on a student. If they have a self-carry contract, then it would be on their person. The student and the nurse and the parent would decide where it was kept. But if you're talking about like a medication from home that's, going to after school or, but it's an emergency medication, that is handled differently depending on the grade level and the school and each individual situation and each health office and each student. Like, I think it's a pretty individual conversation, and I think that's why there's not something about that addressed in the policy.
Yeah, what is addressed in the policy on page 3 in the non-red line version, number 7, prescription and non-prescription drug products be kept in a locked cabinet if required, drawer or other safe place. And then it goes on to talk about counting, documenting medication. And so that flexibility is purposefully included in the policy. I think what you might be implying, which is like certain medications need to be accessed quickly. Healthcare staff are, obviously sensitive to what kind of drug it is, right? To make sure that little hands aren't grabbing things that they shouldn't be grabbing. And so, does that answer your question?
It does. I almost feel like I need to have a one-on-one discussion about this as well from some personal insights things that I've seen this year. I don't really know how to phrase it in here, but I just have concerns about when there are self-carry options. Where are they kept? Is there consistency about them not just being in a locker somewhere so other students, if they know it's there, could access it? Do we have something going on there? But also understanding they are emergency medications for a reason. And we do not want to limit access to them. And how do we do that? And are we doing it consistently across the district, or is each health office going to have some different practice set up in that particular school?
Well, I think that, and correct me if I'm wrong, I think that the reason that an individual student who is being authorized by a healthcare provider, a school nurse, and the parent or guardian, the reason it's in a contract is because it must be addressed on an individual basis for the individual student, the medication, the way that the medication is administered, and taking into account maturity and development and what you're discussing. And so I think if you required a universal practice across schools, that might actually be a disservice to what the contract is trying to accomplish, which is an individualized approach to the student, medication, and then all the other factors that have been discussed. Is that correct?
That's accurate, yeah.
I mean, I acknowledge that, but also acknowledge that students can get access to other students' things.
Yep.
And I've been very aware of how certain practices, which is why I would like to have a conversation more direct about that specific, about some of the specificities that I'm not going to get into tonight.
Yeah, I appreciate that. And I will say, just to clarify, like self-carry really means on a person. So if it's a child who carries a backpack all the time, or our diabetic students who have a fanny pack or a purse on their body, or if self-carry shouldn't mean it's in their locker and they're in a high school going, class to class. So self-carry really means on their person.
So we're assuming that isn't that an assumption though, that if there's a self-carry that it's always on their person? I mean, students forget stuff.
Yep.
Adults forget stuff all
Yep.
the time, like we're not always consistent all the time. It may stay somewhere, for something. I would like to have that conversation, but I feel that giving you guys a little bit more, of what a personal experience looks like would be really helpful to finish that conversation.
Well, one thing I do want to lift is that if a student was doing something that would be in conflict or like in violation of something under the BEP, right? Like if the meds, or if they're not following the contract, I would think that that's something that like the BEP or, there would be some other process or policy that would kick in.
The student conduct.
Yeah, student conduct, thank you.
So I wonder if Martha, you want to connect and maybe give your experience. And I think when we're doing like the policy work, there's a policy and then there's like the procedural pieces. And maybe your experience can definitely inform a lot of the procedural pieces. Like, what does the contract look? How do we ensure like the contract, is offering different options for safekeepage of medication and somewhat of that. So yeah, I think maybe having that conversation. And if there is, based off of that conversation, some pieces that we definitely need to update within the policies specifically, then I'm sure that will come back to Petra. And we can make sure that that is included in there.
Yep.
So how does that sound?
I like the way you phrase that because there's a lot of students that use emergency meds for different reasons. And one's memory of bringing them with them all the time is not always a thing. People forget stuff all the time. So I'm not going to acknowledge that there's stuff out there. We can do the best we can. And then we're always trying to plan for a lot of different types situationally by making things accessible while also keeping safety standards in place at the same time. So,
Yes.
Yep.
Yes.
Okay, great. Thank you. And then again, like all of our policies, they can always come back to us if there need to be updates. So, and we'll have a second read too. So, any other question? Oh, Nikki, sorry. And I see Blair. Okay, go ahead, Nikki.
Yeah. One, I think we definitely need to have it in writing that to a parent if an accidental medication. For legal purposes, I seriously wonder on child endangerment, if we don't have a written record of what happened and that the parent has to request it, we're gonna get sued. I'm sorry, but legally, that's just something that baffles me, that we're not going to provide notice, an immediate notice to the parents that the child may have overdosed on the medication and then not have a written documentation of it. To me, sounds really kind of scary. But the rest of it is an excellent policy. However, my last part that I also worry about is what happens if the student is suicidal? What happens when a lot of kids are? I know I was in middle school. What happens if they're carrying their meds with them and they choose to overdose? How do we work on that? And I know we can't catch everything and we do the best we can, but is there a way? Is there a safe way? Maybe increasing knowledge of where you can keep the medication safely if the student doesn't feel comfortable keeping that on them. And I recall myself in middle school not being comfortable doing that. And the school nurse chose to do that. Yes, I was allowed to self-administer. However, I asked not to because of the state I was in. And I'm glad I could do that, but not everyone can. So I'm wondering if we could put that in there. Otherwise, everything else looks perfect.
Yeah, I will say the self-admin is definitely optional. Like, I mean, most of our medication is safely kept in the health office. And so nobody is forcing anybody to self-admin any medication in our schools. No nurses are doing that. We are happy to administer all of the medication. We often educate and try to create self-advocacy in our, for example, our diabetic students. We would love them to be able to administer their own insulin, and we teach them and spend a lot of time educating and promoting self-advocacy so they can do that themselves. But I mean, I gave insulin to a high school student this summer, all summer, because she wasn't comfortable doing it herself. And nobody is ever requesting a student take medication themselves. And then I will say for our, the changes in the policy regarding non-prescription medication that can be self-carry, in our policy, we state that it should not exceed a week's worth of dosages. And that's what our policy states. In reality, what we do in our practices around that, around self-harm and suicidal ideation, is why our nurses are part of our student service team and work directly with all of our student services team in that. And so we're trained in suicide risk assessment and are seeing students with mental health concerns all day long, every single day of the week. So I appreciate your comments, and I think that that's, we can put the limit of medication in the policy. And that's just policy, and who knows what's really happening and what's in kids' backpacks, because we're not searching backpacks. But we're, using all of our other resources at hand in our collaboration to try to address those other concerns that are really valid concerns.
Okay, looks like Nikki's question was answered. Blair, I know you had your hand up. Are you taking it down because you're done, or?
No, I have two questions. One is, I just heard you say that like a student could self-carry and self-administer insulin, but when I'm looking at the policy and it's long and comprehensive, so maybe I'm missing it. It looked to me like students could only possibly be permitted to self-administer non-prescription meds. Can you point me to the part where a student, like based on this policy, a high school student could self-administer insulin?
So when I was speaking to self-administering insulin, I was speaking to it inside the nurse's office.
Got it. Okay, that makes sense.
Yeah.
Because based on this policy,
yeah.
if I take my prescribed drug at lunch every day, even if I'm a senior, I need to go do that in the nurse's office.
Yeah, that is our policy. So our diabetic students do self-carry, like they might have a pump on their body, so they're walking around the community and the school all day with insulin being pumped into their body at all times. So those students in our high schools and sometimes in our middle schools are adjusting their insulin, and their CGM is also working to adjust their insulin on a daily basis. And so they may or may not be coming to the health office. And again, that is on an individual level where the nurse, the student, the parent have figured out this kid can do this. It might be like the first 3 months of middle school, they come to the nurse and we do it together until we're ensured that but that is like a medication that is injected into their body at all times. So there's no like, I'm not putting it up in a vial of syringe. They're walking around with it on their person at all times. And so that's what I was referring to with diabetic students who might have a fanny pack or a purse or something, because they always have that CGM inside that controls their insulin.
Yeah. Okay, and my second question is just about like a practicality. Imagine I teach high school social studies. I have no idea which one of my teenage students with menstrual cramps has this form.
Right.
And I'm not gonna, right? Like that's not something I'm gonna probably know. I mean, maybe I would, right? It would be in the health report that I get printed off at the beginning or in their IC flag. But I find it very hard to imagine remembering which child has this flag for Midol and which child doesn't. And so I'm kind of curious about how you imagine this going in the day-to-day at our high schools in particular, about student possession of non-prescription meds.
I think in practice, I don't think we're asking teachers to. I think part of why we're changing this language in the policy is because we don't want you to be believing that in class. Right? Like we want the students, if they have cramps, to take their ibuprofen when in their classroom, if they need to, or out in the bathroom or whatever, and, you know, hopefully get ahead of it and keep going on their day. If they are meeting the policy language to be able to do that. And so I think that the reason we're putting this in the policy, part of it, a small part of it, is to take the burden off of our teachers who are constantly bringing us students like, I don't know if they're supposed to have this, you know, that happens all day long. And so I think the language is so that you can, as a teacher teaching in a classroom, be like, okay, that they must, you know, I think it's to take that burden from them.
And then I guess in addition to like the practicality, for high school students who want to carry Midol or ibuprofen or whatever, is that medical consent and the contract? Like, I don't think the school nurse wants to meet with all, 700 girls who want to carry this stuff and have that contract. So are you imagining that it's like kind of automated at enrollment, or this is more procedure that I should just wait on? It's more procedure that I should wait on.
Yeah.
Okay.
I mean, I think in reality, we're adding this policy language because this is happening all day at our high schools. Our students are taking these basic medications all day on their own without any
And this gives something to it.
Yeah. Yeah.
Okay.
Yeah.
Get it. I really appreciate your work on it.
I really appreciate the comments from a high school teacher lens, and the purpose of this is to like take some of that burden off and make it easier for our high school students to be independent self-advocates of their own health, and to really, make it through the day with cramps and not have missed school days, take their Lactaid when they have an ice cream out at the food truck because they know how to do that. It's all teaching self-advocacy skills and really, a step toward health literacy, which is part of our wellness policy as well.
Cool. And to that, I really appreciate that, like, it has to be in the manufacturer's package.
Yeah.
for me, right? Like I'm thinking about me watching teenagers be like, "Oh, I'm just gonna shake it out of my little plastic bag," and I'm like, "Oh God, I don't know about
Yeah.
that."
I will, you know, we all know that.
Policy language about that,
Yeah. And this is policy. What will happen in practice?
right? I appreciate that. That
But
for
this is the
me as a
policy.
teacher, people can be like, "Oh no, I gotta send you to the nurse with that," because like that baggie full of pills is not gonna work. So I appreciate that a lot.
Yep.
Okay, that's it for me. Thanks.
Thank you, Glenn. Any other comments, questions, thoughts of board members? Okay. So just to quickly recap, for this policy, Martha, you will meet, with Leah. And then give your experience, to possibly inform some changes or, procedural pieces that will come back to legal, to then like make sure that everything's fine. And then I think, yeah, I think that was the only biggest piece for this one. In terms of that, and then we'll have that second read. So that's, okay, thank you so much for.
Thank you.
Hey.
Thank you, Mandy.
Thank you.
Oh, one point.
Yes,
real quick.
Nikki?
Can I also meet with Leah to discuss the letter notice to parents as well?
Sure.
Yep.
Thank you.
And it will be my health services director, but I will make the connection.
Facilitate.
Yep, absolutely.
Yep, that works.
You don't want.
Okay, thank you, Nikki.
Thanks.
Okay,
Thank you.
last two policies. 6700 proposal for naming an MMMSD building or facility, and 6701 proposal for naming a facility or area within the school or school campus. We have been ready for this one for some time. And we are proposing urgent. So Dr. Stanford, go ahead.
So thank you. Good evening, everyone. I am Carletta Stanford, the Assistant Superintendent for Schools and Learning, and I'm also being joined today by Chelsea Tubbs, the Associate Superintendent for Educational Programming, as this work will fall under her work stream forward. So I want to take you through policy 6700 and 6701, starting with adoption dates for both policies. We wanted to be sure it was intentionality around bringing these two policies together because there is a great deal of overlap between the two. Next slide. There are three big buckets of work and changes that we are proposing this evening. Those three are around clarity of the process. Right now, there's a lot of ambiguity between the two. Also creation of guidance and to help to monitor how long it takes to get through a process, and also to think through capacity and the identification of timelines. So thinking through those three buckets, just wanted to provide a high-level overview. So we wanted to be sure with the changes that we are establishing capacity. Right now, currently, as the policies are written, there is no determination for how many name changes you can do within a year. So the proposal is that we have a maximum of 2 schools that can enter into the renaming process per year. The second big bucket of work is around developing the guidance for entering into the process. Currently, anyone can come and say that they want to rename a school, and we enter into this long process. I'll just say that it's a long process. So we wanted to be sure that we put guardrails on what are the expectations that will determine if you will move forward with a name change. So that proposal includes having a survey that will be developed so that we will have the input from the community and from staff and from students and from families around if they agree that they want to enter into the process of changing the name of the school. The third piece is the renaming committee. There needed to be clarity around who needs to be a part of the renaming committee, specifically who makes up that body to make those decisions. We know that this is really important work that we do when we enter into a decision to rename a school. And we want to make sure that the makeup of that committee is representative of our district and our school in which we are. So that is also clarified within the recommendations that we're bringing forth this evening, to be sure that at least 50% of the membership of the committee is composed of school members. And the rest can be community members or other stakeholders. We also wanted to be sure that we have a minimum number of folks that will be a part of that committee, and so that number was 7. So there'll be 7 members. You can have more, but you cannot have less than 7. And the last piece is the renaming timeline. Currently, it can take as long as we want it to take. And so again, when we think about capacity for what we want to do, the importance of the work, making sure that we have stakeholder voices, we are proposing that the timeline be a maximum of 6 months. Doesn't mean that we will use all 6 months, but we're giving ourselves a maximum of 6 months because we also understand that there can be some pauses if there are members that are not able to make the committee. We've experienced that before. We've also experienced times in which committee members had to drop off and we had to find someone else to fill that spot. And so we wanted to be able to have some flexibility within that time frame, while at the same time having a cap so that it does not continue to have no end in sight. So those are the 4 high-level recommendations that we're making for both. Again, it's 6700 and 6701, but these changes would be made for both policies. Okay. Questions?
Nikki, I saw your hand first.
Just one quick question. Excellent work, both Carletta and Chelsea. This was great. It provides a lot of clarity, including the fact that as much as I like having the power of choosing a name that's separate from all of them, it's probably not the best practice to do it. So we finally have something that's codified and we can work with that. And I can live with that. My one question is on the superintendent. If there's more than one name, the superintendent then has the right to choose that. If there's a tie. Is that what I'm reading on the red line?
So it's 2 different things. For 6701, because that involves the school, that name goes to the superintendent first, and then the superintendent makes a decision based on the recommendation of the school and then passes that on to the board for a vote, which is a little different than 6700.
Okay, that was the confusion part.
Yep.
I thought they were the same thing, and I'm going, those are 2 different things, so I wanted to make sure. That's all I have.
So the proposal for naming a facility or area within a school or school campus is more so, for instance, when Lori Mann Carey, before it was Lori Mann Carey, when it was Southside, before it was Southside, it was just a new school that needed to be named.
Correct.
Per DPI and per like state law and things like that. Southside was the placeholder of the name.
Correct.
And then we went into the official renaming part to process to actually give it its own official name.
Right.
So that's what 6701 is saying.
67.
Got it.
6700 is saying. Okay.
6701 is within the school, so that can be like
Like
the
athletic
library or the athletic
facilities.
facility.
Got
Right.
it.
So that's more of a school-based process. So that starts with someone in the school can say, hey, I want to name the library after Michelle Nichols, right? And their guidance for having it named after someone who's living. And that process lives with the school and that committee. And then that committee makes their recommendation to the principal. And then the principal passes on that recommendation to the superintendent. And then the superintendent passes that on to the board. Okay. With 6700, there's a board that's formed. It's more of a community involvement with different stakeholders that make up that renaming committee.
Right, the renaming.
Correct.
Citizens Committee.
Yes, the renaming citizens committee. And then those 4 names move forward to the board decision.
Yeah.
I also want to say that another change that, or recommended change that we have in place is that there will be 4 names that will move forward to the board. Within those 4 names, 2 of the names have to be a person, a prominent figure nationally or locally, but that person has to be deceased. It does not all have to be, all 4 names do not have to be after a person. It can be a
I see.
thing or
Direction.
direction. Or,
Southside.
yeah.
Like direction.
Southside, yes. Right. Northwest Elementary, Forest Green Elementary, you know, so, yeah.
Got it.
Got it. Okay. Okay, Martha, Blair, Michelle. Go ahead, Martha.
I just want to say I appreciate all the work put into clarifying all of this because I think the discussion behind names are really important, and some of the stuff that came out from when like when Anana was renamed, like we learned a lot about what the other name was housed with too. So I thought there was a lot of learning that went on when you allow the bigger discussion to open up and the intentionality behind renaming something, but also making sure that we're not just doing it with a singular ask. Like we're getting a lot of community input, a lot of people are engaged in it, and people know where it came from and where things are going. So thank you.
Thank you, Martha. Go ahead, Blair.
You. I have a question and maybe a problem with the idea that only the people who go to that school get to decide. I'm thinking in particular of Lindbergh, like famously anti-Semitic and racist, also famously pilot, but like, you know, that affects more than just the people who go to that school or the staff who work at that school. And so, so I have questions and concerns about that. This like a school community sometimes is bigger than just the enrollment at that school. So that's something that I think gives me pause. Otherwise, I appreciate the clarity, but that's the one that I'm like, you know, I talked to other Jews all over the city, and we're like, we can't believe there's an elementary school that's still called Lindbergh.
Yeah, that one's
You know,
always
and I don't know that any of us in those conversations have kids at Lindbergh or work at Lindbergh. And so I think that's something that we might want to think about. And I don't, you know, that's just my thought. It's not a question. It's just a comment.
Blair, can you clarify when you say only the school community? Are you talking about the 40% for the survey?
I am, yeah.
Got it. Thank you.
Thank you.
Thank you, Blair. I agree with that a lot.
Manka, I don't know. Are you coming on screen to also respond? Sorry. Her screen just came.
I know, I see a background, but her camera's on.
Okay. Okay. Go ahead, Michelle.
Oh, am I next? Oh, great. Okay, to that point that board member Mosner Feltham made. So the way I was reading the 40% is that, well, let me back up and say this. Sometimes when, at least since I've been on the board, we have sometimes received a lot of community emails from people who think a school should be named after a person. And they're garnering a lot of support about who they think the school should be named after. What I think the survey is doing is saying, we need to ask the school community, do you all want to be renamed?
Correct.
Right?
Correct.
And so that if there is 40% of the school community that's like, yes, we're open to this.
Yes.
And then they form a committee.
Yes.
I guess my wondering is what happens to all of those community folks that were like, we want the school named after this person? Because we've had a couple of very significant local leaders who passed away. And there were people in our community who really lobby isn't the right word, but I think, you know, kind of organized and galvanized for some of our elementary schools to be named after those local leaders. Now, some of those individuals ended up being appointed to the Citizens Committee. And the Citizens Committee still had to go through a process of vetting all the name, you know, all the submitted names. But I guess what I'm wondering is, does this process say if there was a community swell of interest around a school, it has to be directed back to the school community through the survey? I guess it's more of a, I'm just trying to understand, because the few schools that we've renamed have really come from a lot of community leaders kind of petitioning for a school to be renamed after an individual.
Yeah.
Okay,
So we try to break it up into 3 different parts.
beautiful.
So the survey is exactly what you said, to garner the interest of the school community to say, do we even want to enter into this process of renaming our school? That's the 40% of the survey. With the community that's saying, yes, we want this name, this name, this name. If they enter into the process, they still have the opportunity to submit those names through that 30-day window of time. When you all as a board say, we're going to rename Stanford Elementary, entering into this process, now you all have 30 days to submit the names that you would like us to consider.
Okay,
Right? So, and then the committee receives, if they're all of these individual ones, the committee receives every last single individual name, even if they're duplicates, so that they can actually see how many people are interested in a specific name. And we take all of the names. We don't take any of the names off. It can be Bubblegum Elementary, and that's gonna be considered by the committee.
Okay, thank you for that.
Yeah.
So let me, can I just, and I hate to do this, but I need to make it a little bit more practical for my understanding.
Yep.
So when we had Falk Elementary, and then we had community folks really petitioning and galvanizing for Falk Elementary to be renamed Malele, Jacasa
Yes.
Anana
Yes.
Elementary. Were the community leaders, were they in communication with the principal at that time? And was the principal saying we would be open to that? And then something came to us? Cause I don't really remember what happened behind the scenes. But I'm trying to figure out, I agree with the survey.
Yes.
I think a school community has to decide that they want to go through the process of being renamed. So I appreciate that you've added that detail. I appreciate that we're still keeping a board-appointed citizens committee. And a lot of the details you have in here about, you know, kind of the minimum number that needs to be present, and then the process that they'll go through. I still am not seeing how the community and the school community survey potentially come together. And so with the Falk and Malele Jacasa Anana example, I don't know if they were already talking, and then by the time they started emailing the board, the community leaders knew that Falk, the principal at Falk, was saying like, yes, we would be open to this. Or if the school principal was like, we don't want to be renamed, but you guys are already emailing the board. You know what I'm saying? I don't know if you all remember how that process worked.
So previously with the renamings, once you send something to us saying that you want to rename a school.
Who?
Anyone in the community.
Anyone in the community,
Anyone in the
okay.
community. They can say, I believe that Falk needs to be renamed because of these reasons.
Okay,
We enter into the process.
okay,
So what we're
Okay.
trying to address now is, rather than just entering into the process and not knowing, like you said, if the principal or the school community or who's interested, we want to develop a survey to be able to make sure that this is something that the school community is also interested in.
Okay, so thank you for that. So now in this new policy and procedure, you start getting a whole bunch of emails to the board. There's another school. And it's coming from the community. The school hasn't initiated it, it's coming from the community.
Yep.
You all are gonna get those emails and you're going to now reach out to the school leader and say, hey, there's some people interested in renaming your school. And the principal goes, oh, wow. I didn't know, or, oh, yes, I'm aware of that, whatever the case may be. And then you're saying to the principal, we need to survey your school community.
Correct.
Okay. So that happens, but then what are we telling the community people? We're telling them it will depend on the school community survey results?
Correct.
Okay.
Yep.
And are we expecting the principal to administer the survey? And is it 40% when we say school community, is it of the staff and students and parents? Or, and I know this is very detailed, but it's just, what do we mean by school community? And maybe it's in here?
It is in here.
Okay.
I'm just gonna point, I think it's 2. Under procedures, under 6,700.
Yeah.
Number 2.
40% of the total.
Surveyed school community approves considering the name change.
Only
Only staff and students assigned or enrolled at the school may be counted. So it's that section that's.
So staff and students and not family members.
As it's written currently, yes, staff and students.
Was there a reason why you were thinking not to include the family members or?
Not at all. It's something
Okay.
that can be, yeah, that we can definitely add.
Okay. I would wanna, I'm thinking a little bit more about that, but
Yeah.
I'm thinking that,
It makes sense to add to me. I think that's just.
yeah.
Yep.
Okay. All right, thank you. Well, I really appreciate all of the work that was done on this. Yeah. I think it will make the process much clearer for the schools, hopefully the community members, and also for the board. And I don't have any opposition to limiting it to 2 a year, and that's across the entire district.
Correct.
So can I ask you, I know this is a policy meeting, we have some schools that had been waiting.
Yes.
And so what happens to the schools that are currently waiting while we're now updating this policy?
So there are currently 2 schools that will be in the process this year because this policy hasn't been updated, so we're going by the previous policy. And so those 2 schools are LVM.
Okay. All right, thank you.
Yep.
So if you might consider maybe including, maybe it's
Family
some percentage of parents and caregivers, maybe, I don't know. But it seems like that would be also important, because it's parents who are enrolling their students in MMSD, so it'd be, I think they're an important voice to also include.
Yep.
They gotta buy all the new school swag with the new.
Right, right.
Okay. Got it.
That does it. Thank you.
Blair?
Wonder about for number 2 in the procedure, adding something like, except in circumstances where the existing name contradicts MMSD's stated values, the board shall only consider proposed names when the school agrees. That would be something that would fix for me my concern. Something to consider in the second read.
Where do you see, oh, sorry. What
No,
was,
6,700.
Yeah,
Where she
where do you
talks
see-
about like the 40%. Number 2.
Oh.
That.
So I'm proposing, or I'm suggesting, I suppose not quite proposing, that rather than reading the board shall only consider proposed names after meeting that approval threshold, we change it to read, except in circumstances where the existing name contradicts MMSD values. So that would mean like, even if Lindbergh people are like, we don't really want to deal with this name change because we're doing other things, because the name is a person who's a known anti-Semite and racist, we would say the contradiction in values sort of supersedes the approval threshold. And that's an idea for the team to bring back for the second read.
I see what you're saying.
Yeah, thank you, Blair, for that.
We should definitely talk that one through.
Yeah, we can talk that one through. I mean, yes, we can talk that one through. Any other people have any other comments before I say my comments? Okay, so I know that I've been pretty direct and vocal about this. I honestly don't think that we should be naming schools after people, period. I think we get into this person was great and they did a bunch of stuff, and then later you find out this person was X, Y, and Z. Then it like starts it over. And then so thinking about just the humanness, and thinking about, you know, one of the things about well, I won't go with that. I just think like moving forward, I would just like to say no school should be named after people, and we should just consider naming schools after other things other than people. So that would just be my suggestion, like moving forward. And I think that that would go into, if we were to even consider or entertain that, it would go into, I think the two names having to be a person, and then removing any requirements around, you know, if a person is deceased or not. I mean, I think it's a little different when you have like the living, but even then, I don't even think that we should be naming anything after people at this point. So that's just my own kind of thought. It is great to commemorate people who have done great stuff in our community, and you know, there are certain names like that I am proud of that schools are named after. Currently, there are names that I just, you know, there are people that I'm not proud of, but at the same time, there are people in the community that are proud of certain names and don't like the rename. And so if we're always just balancing, you know, I'd rather name a school Bluebird Elementary or something like that. Like, who's gonna hate Bluebird? I mean, some people might hate Bluebirds. But again, it gets to that point of, you know, finding other ways to name our facilities and paying honors to other things than people. So that is my opinion on that. And I mean, we can have another discussion about that or think a little more deeply. But I think it just will just help us just avoid all of this in the future. In terms of names of people and yeah. So those are my thoughts.
Thank you.
Any other comments, questions, thoughts around this renaming and naming? Okay, so thankful for y'all to bring this forth. Thank you for the work.
I'm
Go
sorry.
ahead.
I know,
Petra.
I know we all want to go, but I think one thing that now just like in conversation
Okay.
that I do want to lift up is considering when the school community is required to conduct the survey. Because right now, as it's written, it says the board shall seek proposed names, right? So it's the board initiating that. So that would mean that even if the public was emailing and saying, we want to rename this school, there is no requirement of the school committee to administer a survey. So if we're fine with that, but I just want to make sure it's capturing the board's intent.
I see.
So do we want, like, do we want to have anything trigger a requirement, or are we fine with how it's written out where it's like, this is more sort of at the board's direction, at the board's discretion?
Interesting.
I'm fine where it's at.
Okay.
Yeah, maybe we should think about that a little more deeply, and maybe we can figure out maybe some options, because currently with this board, like with this iteration of the board, like I could be confident with my colleagues to say like, okay, if someone was like, we would have a conversation, folks would be fine with that. We'll talk about like, okay, maybe we can initiate this process. But thinking of like future boards and different iterations of the board, that might not be the case. So maybe if we do find some way that actually triggers the board to have a conversation and what that might look like, I think maybe. I think would be good.
Okay, thank you.
Maybe that's something you and Carletta could
Yeah,
talk
we can,
about
we can chat about.
Yeah.
Yeah,
in preparation for the next week.
sure.
So the two things that I'm hearing from this proposal, thank you again for the work on this. Considering the language around except, in the cases where, such names may contradict the values of MMSD or, MMSD's, values. To Blair's point, and I didn't capture that exactly, but I'm sure Petra has that exactly, Blair. And
It
then,
doesn't have to be exactly.
yeah. But then also the consideration of possibly just striking human names completely as a consideration, possibly what that might look like. I know, I know people are gonna be, but I do think it is a consideration. I think it is important for us to take seriously and think about more deeply, especially because there are a lot of things that are coming out, a lot of things that have been moving, at least since I've been on the board. And I'm happy that this has come back to us because this has been a conversation the entire time I've been on the board for the 5 years. So thank you all for the work. And then I will.
And the inclusion of families, perhaps in the.
An inclusion of families in the part where there's a survey for only staff and students, families and caregivers, and figure out the best language around that. And then that's it for this one. And go ahead, Nikki,
So
what?
moved.
Okay. So Nikki has motion to adjourn, and then we got a second from President Nichols. All those in favor of adjourning, high five. 1, 2, 3, 4, 5. That has been unanimous. We are adjourned. Thank you all so much. I appreciate it.
Maya, thank you so much.
Yeah, thank you. This was.